understand, at my house, I'm under a fur blanket, and my husband has the AC on.
Yeah.
And I'm like, okay. I know. It's just hate to be really cold.
Okay, welcome to the Deschutes County Board of Commissioners meeting for 9 a.m. Wednesday, July 7th, 2021. First item on the agenda is Pledge of Allegiance. Please join me.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
At this time is citizen input. I guess our agenda, we have a new agenda system. It's a little bit different order here. But citizen input for any item that is not on the agenda. We do have emails, and if anybody is willing to speak on the subject, if there's a raised hand feature in Zoom, if somebody wants to use it, or a phone number that we don't recognize, we could ask. We do have multiple requests for, well, there's a special thank you for fireworks ban, but also a request to extend fireworks ban. So these are all the same topic. I'm not going to read all the names here. They will be part of the record. So there's about 5 for please extend fireworks ban and a couple for thanking us for that ban during the 4th of July holiday. Seeing no other citizen input on this at this time, the next item is consent agenda. We have 3 sets of minutes and a couple items.
Oh, I did want to say something.
Oh, sure, yeah, anything, any other item?
I noticed yesterday that there were 14 hotshot fire people from Prineville that had died in the 90s, and their death was acknowledged with several of my friends from Crook County, and I just thought, oh my gosh, it was like, I think it was 1994, but just what a devastating effect that must have been on their community at that moment in time, and recognizing that they were protecting us. So they may be gone, but not, yeah. Anyway, that was really quite, I wasn't aware of it. Maybe I was, but it, what a horrible, horrible loss that they were from Prineville. So
If I remember correctly, there's actually a memorial for them at the county courthouse building in Prineville. So
yeah. Anyway, just
that was kind of close to home for us too. My wife was working for the National Park Service in Hawaii at the time, but she had just gotten certified for firefighting, so she had crossed paths with that industry and some of the training that those same gentlemen were at, and then she heard about that. So very, very impactful in 1994. Yes.
Anyway, so move the consent agenda.
Thank you.
second.
Okay. Any other discussion? Seeing none, Commissioner Dare.
Yes.
Commissioner Chang?
Yes.
And Chair votes yes. At this time, action items number 7, consideration of signature of an intent to award contract for landfill engineering and construction. Good morning, Chad.
Morning. Chad Santola, Interim Director for the Department of Solid Waste. This action item is for issuing notice of intent to award for engineering and construction management services for Cell 9 at Knott Landfill. We're at the stage in filling operations where we need to get our next cell constructed. In April, we issued an RFP for those services and received 3 proposals. A review committee between the Solid Waste Department and Road Department selected G. Friesen Associates for that project. And we've worked with Jerry Friesen before. He's done quite a few of our cells out at the site. Well-qualified proposer. So there's a pretty straightforward evaluation. So the action item is for that. Jerry's work will include doing the engineering and design work for the liner, preparation of the approval documents we have to get through the Department of Environmental Quality, and then doing construction administration services during the actual construction of the project, which will probably happen in January.
So one thought, we have worked with him before, and is it kind of the shape of the cell that's the engineering at this point? Because we'll probably use the same materials and the same.
Well, currently the liner design is fairly consistent from cell to cell. This cell in particular, there are some differences because of where we are in our filling operations. We'll not be doing a pumping system for that. It ties into a previously existing cell. But the preparation of the DEQ documents is a unique process for each cell. There are some new rules coming down from the DEQ regarding methane emissions from landfills, and they're still in draft right now. I'm preparing some comments to the DEQ on that. That may entail some designs or changes in design for the liner system. I've been talking with Jerry Friesen about this. I'm not sure what changes will come up, but that may change the design we've been using for the prior 7 cells out of the 8 cells we have now.
So it's kind of the slope and the design, and yeah, just like you say, there's not a new sump system. This will flow into an existing low spot.
Correct.
And that's for the recirculation of any liquids.
Yeah, well, your comment, yeah, the shape of it varies from cell to cell. That's kind of a unique part of the design. In theory, we use the same liner system throughout, but these new landfill gas rules may compel us to do some changes in that. We'll evaluate that during the design phase.
Great. Okay.
Chad, I'm curious about like the kind of the realm or the world of engineering firms that do this work. Looks like we got some good competition for this contract. Like how far abroad do engineering firms propose from for a contract like this? Are these all Oregon companies, or Pacific Northwest, or Westwide, or?
So Jerry's an Oregon firm. The second proposer, Civil Engineering and Construction Associates, they have offices in Washington and quite a few offices back east. The third proposer was actually from, I believe, Oklahoma.
Toledo, Ohio, maybe?
I'm sorry?
Toledo, Ohio?
Toledo, Ohio, yes, that's correct, yeah.
Close to Oklahoma.
Oh, something.
It's
Yeah.
an
One of those O states. So when we do solicitations, our standard bidding process is advertising in the Bend Bulletin and the Oregon Daily Journal of Commerce. And on this project, there were, I think, 6 plan centers that downloaded the specs. So they end up distributing it to their clients, and that gets us a little bit better distribution nationwide. Depending on the project, we may do additional solicitation. Right now, we're looking for statements of qualifications for landfill siting work for a new landfill, and we actually posted that on our trade association's website as well. So we've had inquiries from a number of companies I've never heard of throughout the United States. So there are firms nationwide that do this. It is nice having local resources, especially during the construction phase of the project. Things can change pretty fast with challenges that come up. That wouldn't preclude necessarily from getting somebody from out of state for, for a project as well.
It was really nice to see that of the 5 people analyzing the 3 bids, you were all consistent for second and third. So, that makes you feel a lot better. And the fact that he is from Lake Oswego, I think, is excellent news.
We have a lot of confidence in Jerry Friesen. He, like I said, he's done a lot of work for us over the years, and we do get some value-added product out of him as well.
Great. Thank you, Chad. So move the notice of intent to award the landfill cell number 9 engineering and construction management services project to G. Friesen Associates Incorporated.
I'll second.
Okay, so then just acknowledging this is not the low bid, but this is, has been done through the proposal review scoring summary and a very serious process. And this is the public moment where we're letting the world know the selection. So that's what we're doing here. Any other discussion? Seeing none, Commissioner Dare?
Yes.
Commissioner Chang?
Yes.
And Chair votes yes. Thank you.
Thank you.
Item number 8, consideration of signature approving the disinterment and reburial of graves in the Greenwood Cemetery. I haven't used the word disinterment ever, I don't think, in my life. So,
Yes, Commissioners, this is the time for board consideration of adoption of Order 2021-020. I see counsel and her client are here today, so I'll let them take over and explain it to you. I hope the memo captured some of it for you as well.
yeah.
It's pretty unique. It doesn't happen too often, but there you go.
Thank you very much for joining us today.
Thank you, Commissioners, and I appreciate the opportunity. Laurie Craighead with Craighead Law, LLC, representing the Oregon Care Group and Niswonger Randall Funeral Homes on this. Just to reiterate what was said in the memo, this is to disinter graves of people who have no identity right now. They were in pre-set 1970s, and so we have no idea, have no records of their next of kin or who might have actually placed them in this location. Also, just to reiterate, there's the statute provides that if you can't get a hold of the kin or get the consent, then the county must consent to the disinterment and moving of these bodies to a place that would be more suitable in this cemetery. I'll let Mr. Precht explain those, but I also want to reiterate that the statute does not provide for a public hearing process, nor does it really have any criteria for approval or disapproval of this. So it's very vague. It's just one, pretty much one little statute there that just requires us to get consent. But I will turn it over to Kevin Precht, who is both president of both the Oregon Care Group and the Niswonger Rentals Funeral Home. Oregon Care Group owns the land, owns the cemetery. Niswonger is the ones that operate that. So,
Thank you for joining us.
Thank you. Yes. Do you have any specific questions for me?
Well, so I see you have provided a letter on the topic and the memo. Thank you very much. So this is existing graves, maybe just on the ground. I haven't been to the site. I know the site, and I drive by it, obviously. But yeah, just tell us a little bit about the sense of place that we're working with here.
Sure. The unidentified human remains are in an undeveloped portion of the cemetery that is zoned as cemetery. It's basically sagebrush. It's on the western side of our shop that just has never been placed into active duty cemetery. This ground was used, unbeknownst to us, many decades ago for placement of human remains without, as Lori shared, without any specific process for that. At this point, we're experiencing significant desecration of the remains and the graves that we're very sensitive to, and so our desire is to move those over to our kept portion of the cemetery, which will be a much more secure location for them and much more dignified, and it's in a manicured portion with green grass and trimmed areas and things like that, and that will be placing a monument to those folks out of a sign of respect for them and a desire to treat their remains in a dignified way.
Great.
I also wanted to reiterate that although we did not know who to get a hold of for consent for this, out of an abundance of caution, we did send a 60-day notice to the county's public health authority office in case they had records of who these people might be, because them or their predecessor might have been the ones that caused these people to be interned in this cemetery. So.
Okay, well, once again, this is the public process, putting it on an agenda, letting the world know that this is being requested and acknowledging that this action. And we're doing this by order today.
And I also want to thank Mr. Doyle for helping us with getting it on the agenda for the.
Yeah. Great. Any other thoughts or questions?
I'm curious, this area that these remains are being moved from, do you have long-term plans to develop it more formally as a kind of more maintained, secure portion of the cemetery, or is like in a certain point in your narrative you mentioned because it's close to the highway, this is maybe not not people's first choice for the place where they would inter people, but just curious about the kind of the long term for this.
There's no long-term plan in place for any sort of change from what it currently is. It's currently zoned as a cemetery, and we have plenty of available inventory in the already developed portion of the cemetery that economically doesn't really justify developing the undeveloped portion at this time, or really in any foreseeable future. So it'll stay as is.
Okay. Your motion.
So move adoption of order number 2021-020.
I'll second.
Okay, any other discussion formally? Seeing none, Commissioner Dare,
Yes.
Commissioner Chang,
Yes.
and Chair votes yes. Thank you very much. A little bit of formal process in the steps here, and this is the public part of it, so we've done our duty here.
Thank you, Commissioners.
Thank you.
No, and thank you for doing the
Yeah.
kind thing and doing something dignified for people that have been buried like that. I appreciate it.
Item number 9, consideration of approval to receive community-led healthcare innovation grant funds. We see Pamela. Thanks for joining us. Audio. Not quite yet. We're checking on our side. I don't see any mute sign. Not yet. No audio, and we're checking on, just in case there's something on this side, maybe a reconnection. I don't know what, yeah. I wouldn't want to suggest what the fix is at this time. We do have somebody looking at it in the back, just in case.
We've got an expert in the room.
Yep.
There's, I have seen a couple of times before where it's a Zoom glitch, and where you can use a cell phone, call in to the same Zoom call, mute yourself on your computer, and then just talk over the phone. You know, use the phone for audio and use your computer for video. But,
Commissioners, I might point out too, I think we've got this reversed. I just received an email from Dan Emerson. He indicates that consent item 2 was the formal resolution accepting the grant funds that item number 9 is asking you to consider. Apparently.
Well, at least it's in the same meeting.
Yes, so by the consent agenda, you've already approved it, but you may
Yeah.
want some discussion when
Yep.
we get the Zoom
Oh.
up in here.
And we've been able to, review the items also.
Yeah. Thank you, Dan, for sharing that.
No audio yet. So, yeah, there may be a phone number to be able to dial in just from your desk phone if possible. I don't know how we can find that offhand. Maybe Sharon could put it in the chat. Well, it's a nice crystal clear video this morning. Yeah.
My hunch is what happened was that number 2 made its way on consent a week ahead of time and should have been next week.
Oh, yeah, okay.
But, or we should have had this discussion last week that we're trying to have. But in any event, that's what happened.
Well, we'll
If
acknowledge.
for some reason the board's not happy, we're going to have to go back into the consent and,
well,
Yeah, well, we'll have that discussion.
yes.
I did notice the mention of perinatal care coordination on both items, but I'm glad that they're at least not exactly the same, so I
Yeah. Yes, they are a little.
didn't miss that.
Well, today is the first business meeting of the new fiscal year. We do have new software creating the agenda. Municode software is popping the agenda out after all the agenda items are put in. As I say, I acknowledged at the very beginning, Pledge of Allegiance would be put before the citizen input, just the way our agenda flows. So,
Yeah, there's a few glitches
Happy New Year, I guess. That's where we're at, right?
through it.
So, as I say, the audio was working, so maybe it is just a connection, this one connection. Are you also, Pamela, are you also doing the next item, the next? Yeah, okay, so we'll get her fixed up. Brent, do you think it's something local? Yeah, we're not sure, okay.
Pamela, do you have a phone handy? I mean, a landline would also work to try to do the video on the computer and audio on a phone.
Oh, Sharon, could you unmute and test audio, please? So I see you're unmuted. We don't hear anything. Okay. So she's confirming that she's there. So yeah, we can see you and not hear you. So,
Interesting.
and we'll
And
wiggle
her lips
wires.
are moving, so
Yeah.
this is not good. But she's smiling.
Yeah. Okay, well, so Pamela, it looks like it's not you, just letting you know. Yeah, so at this time, it is 9:20. Let's just take a recess. We're going to possibly reset this whole meeting. We haven't had these problems in the past, but audio has been an issue possibly. So this, we'll take a 10-minute recess, and we will check on the situation then.
I mean, I'll go outside and warm up.
There you go. Go on out.
Okay.
All right, so welcome back to Chiefs County Board of Commissioners meeting, July 7th. At this time, we are going to have the next two agenda items. Pamela Ferguson's going to join us, and we're going to use a telephone, speakerphone on a microphone, and then our next items will all be in person. So this is just happens to be the situation today.
Are we video streaming or?
So yeah, let's utilize the video like we did have. Okay, yep, so then, yeah, we had an echo situation. Ooh.
That's better. Okay, go ahead, Pamela.
Welcome, Pamela.
Good
There we
morning.
go.
So sorry for the technology.
Oh, no.
For the record, I'm Pamela Ferguson, one of the public health program managers, and I'm here to talk about two items. The first item I heard was moved to consent, but if you have any questions, I'm here to follow up. We were one of 7 grantees that were awarded a grant from the Central Oregon Health Quality Alliance. So we were delighted to hear that we were awarded $30,000. So I'm here today to request approval to accept those funds. I was here on the 19th of May to talk about this grant opportunity, and it will allow us to continue our evaluation process for our perinatal care program.
Yeah,
Any questions for me on that?
I already talked about it.
yeah.
Pamela, I believe that this this evaluation and another position or some additional staff time was one of the was one of Public Health's special requests for this last budget cycle. And I don't think we were able to fulfill that one, but I'm wondering how this grant sort of kind of interacts with that, and whether this allows you to get some of the things you wanted to get done, even though we did not meet that special request during budget season.
Yes, good question, Commissioner. The special request was for more staffing, so that would have been another care coordinator. This grant will allow us to look at the program and continue some qualitative evaluation. It does not add any capacity to the current program here in Deschutes, but it does allow us to move forward with what I think is very important, which is to look at the effectiveness of the program.
Great.
So two different things.
Right. Will that data and evaluation be available by next budget cycle?
Yes, that is our goal. And we would like to bring, this information back to the budget committee, perhaps, yes.
Great, thank you.
Okay, well, that puts that in perspective. So this is consideration to receive these funds.
So if we already consent agenda'd it,
Yeah, so I think
Right.
these were basically the same ones. So yeah,
Yes.
this item has been approved in the consent agenda. Discussion was just now. So let's move to the next item, item number 10, request for board acceptance of High Desert Education Service District grant regarding Family Connects bridge funding.
Yes, thank you. The second item, it is essentially a contract that we have with OHA Public Health Division. They send money down to the local public health authorities through our intergovernmental agreement, or an IGA. They also, because this is a brand new program, Family Connects Oregon, have a contract with our early learning hub. They serve as the lead agent for this new home visiting model. What this allows us to do is to not only offer nurse-family partnership, Babies First, Cocoon, but now we will be able to offer Family Connects Oregon to new moms. The Early Learning Hub had $72,000 that they were not able to spend And most of that was to hire new staff. And they reached out to us just recently and said they would like to give us $36,000 of that. 18 will go to Crook and 18,000 will go to Jefferson. So I'm here today to ask for your approval to accept these funds. If we're not able to accept the funds, I believe they will go back to the state. These funds will help us move forward with our implementation, which means we could use those funds for additional staffing. For example, perhaps some admin support to help us as we move forward. We are looking to implement this new program in September, which is when we would start recruiting at St. Charles Bend for families who are interested in this universally offered nurse home visiting program. Any questions?
Pamela, I didn't fully track your explanation of where the dollars are going. So 36,000 is coming to Deschutes County, and then 18 and 18 are going to Jefferson and Crook, or the 36 that is coming to your program is going to be used in Jefferson and Crook, or?
No, it's a total of $72,000 that the Early Learning Hub has, and we would get $36,000 from that amount.
Got it. And 18 and 18 will go to Jefferson and Crook?
Correct.
Okay.
And it was really unexpected. We were not looking to from the Early Learning Hub. But again, they reached out just recently and said they had $72,000 that was unspent, and they would have to return it, or they could push it out to the counties.
And they were looking for a good place to put their money to prepare kids for early learning. That sounds like a great
Correct.
opportunity
Exactly.
to me.
Can you tell us a little, maybe remind us, the Early Learning Hub, so that's an effort of the High Desert ESD. Can you explain that a little?
That is correct. And the director there is Brenda Comini. Okay. And as I mentioned, they are the lead agent for our region for the Family Connects implementation, which is it's a little unusual. Typically, the contracts that we have with the state through program elements, money flows in directly from the state down to the local public health authority. In this case, there was money that went to the hub, and they were not able to spend it.
Yep.
So this is a little unusual, but we were delighted when they told us that they had some extra funds that they could push our way.
And what are the ages of Early Learning Hub efforts, do you know? And maybe I need to talk to Brenda on this, but what are the ages associated with the Early Learning Hub?
Well, it would be 0 through 18. It's typically K through 12 is their focus.
Yep. Well, and so, and I'm bringing that up because there's going to be child care initiatives, dollars spent, a little bit of a summit effort about what are the good investments, what are the let's look for overlaps, let's look for synergy, and in the efforts that are going on in Central Oregon.
Yes, agreed. And I believe in their brand new strategic plan, they have a focus of supporting this effort of universally offered nurse home visiting, yep. Which is essentially a postpartum visit for any new mom who wants it.
Great. We'll look for those collective impact opportunities. Just a fun, the terminology, collective impact. Okay, so at this time, acceptance of funding.
So, I'll move that we approve board acceptance of the High Desert ESD's grant funds to support Family Connects bridge programming.
And I'll second the motion.
Okay, any other discussion?
So Pamela, you said the program's actually going to be started then by our group in September, is that correct?
That is correct.
Okay, and who's going to do that? Do you know yet?
And Commissioners, I would love to come perhaps in the next couple of months and provide an overview of this program. I think it was 2 years ago, Hillary and I came and talked with Commissioner Adair and Commissioner Henderson and I believe Commissioner DeBone, and just gave you just a short update on what was coming. But now that implementation is happening across the state, if you would like to hear more about it, I would love to come and share more with you.
And that's for the Family Connects Central Oregon program specifically, correct?
Correct.
Okay.
Yes.
Okay, well, it's been moved and seconded. Anything else?
No, I just asked who was going to lead it.
Oh, yep, the person. Okay.
And do we have that person identified yet?
I missed that, Commissioner Adair.
Oh, I'd ask who was going to lead this program then, if it's starting in September. Is this going to have to be a new hire, or is it somebody already on our team?
Our current plan is to use the available staff that we have now. So we have a nurse home visiting supervisor. I'm the program manager. So the two of us together are really here on the ground for Deschutes. Brenda Comini is the director of the hub, and she is really leading the regional effort. In the future, as this grows, we may be coming to you to ask for more staff. I don't think we'll be asking for funding because fortunately this is will be offered to Medicaid, people who are on Medicaid as well as commercial. So we're going to work on a reimbursement plan that will cover the cost of this program. So we're very excited, and again, I'd love to tell you more about it if you have time. And I appreciate the approval today.
We'll find time. It's always good to know more.
Okay.
Yes.
Yeah. We still need to vote, right?
Yep.
Yes, we do.
Are we ready to vote?
I'm ready. Yeah, I didn't know if you would ask another question. So I'll call for the vote. Commissioner Chang?
Yes.
Commissioner Dare?
Yes.
And chair votes yes.
And Pamela, I would love to kind of get a better understanding of this whole constellation of programs, you know, the PCC program, programs like this, and just the numerous different ways that we work with families, you know, prenatal, postnatal, and just kind of in those very early years. So I believe I got a little bit of that in my orientation phase, but it'd be great to get a little bit more depth.
Yes, I would love to sit down and share more with you about all of our programs. Thank you.
Thank you.
Okay. Thanks for joining us. Sorry about the technical difficulties. We'll wiggle the right wire sooner or later. Wiggle
Yes,
the
thank
right
you, Whitney. I appreciate it.
wire. It was a hard one. Yeah. Thank you.
Very creative.
Yep. So at this time, would we want to do a COVID update a little earlier? I guess we don't have interpretation
Yes.
services is what I was thinking.
Can we do number Hedgehog Court first?
I think Whitney was getting ready to point out that if we don't have the Zoom,
Yeah.
the interpreter's not going to do a whole lot of good anyway.
Well, and then if Cody's following for Hedgehog Court, or who's going to do that?
One of the planners.
Or if this is a planner deal. Okay, we're going to need them in the room today. Audrey Stewart.
See some planners coming in the hallway.
Oh, right. So let's do that, if they're available. I was thinking it was a road department item, but it's a planning department item.
Don't these these road namings for
One
whatever.
of those discussion items, and then next week it would.
Yeah, so this is going to be up to speed on it. So let's do that. We're going to do item number 12 at this time. Unnamed public road as Hedgehog Court. Please join us. Thank you for joining us in person. We are having technical difficulties on audio. And nice to meet you, Audrey Stewart.
Good morning, Commissioners.
you.
For the record, my name is Audrey Stewart, and I'm an Assistant Planner with the Community Development Department. Before we begin, I have extra color copies of the location map if you would like them.
Possibly. So there is a scanned copies that might have lost light blue lines or a perimeter. So if you do have a clear map.
Yours looks like that.
Yeah.
It's just like a, it looks like.
Yeah, so go ahead and provide that to us, please.
Yeah.
Thank you.
Thanks. Yeah, those
Thank you.
lot lines and,
Welcome.
we miss all that.
Yeah, and then the North Unit Main Canal blue line wouldn't even have scanned at all. I don't think the blue. So yeah, thank you very much for that detailed map.
For background, the subject road is located just outside of the Bend city limits to the northeast. Pioneer Loop extends off of Deschutes Market Road and runs approximately 1.6 miles from north to south. The subject road to be named extends off of Pioneer Loop for approximately 650 feet and serves 4 properties which currently have Pioneer Loop addresses. This local access road was created and publicly dedicated as part of minor partition MP-80-55, and the cul-de-sac was later created and dedicated through minor partition MP-95-32. The applicant has proposed to name this local access road as Hedgehog Court. This road naming was initiated through an application by one of the 4 property owners adjacent to this road. Title 16 of Deschutes County Code outlines the criteria for road namings, and the proposed name of Hedgehog Court was found to meet those requirements. The proposed name was also reviewed by the Deschutes County Address Coordinator and Senior Transportation Planner, who had no adverse comments. Notice of the proposed road naming was mailed to abutting property owners on April 28th, as well as to a number of other agency staff. Per Title 16 of Deschutes County Code, there's a specific timeline for road naming applications. The staff decision approving this road naming was mailed out on June 30th, and assuming there are no objections, this decision will become final on July 9th. Pursuant to Section 16.16.030B of Deschutes County Code, the board then has 10 days to sign an order approving the road naming. The signing of Board Order 2021-030, approving the name of Hedgehog Court, has been slated for the consent calendar of the meeting on Wednesday, July 14th, but can be moved from the consent calendar for further discussion if the board so wishes. Staff also notes that public comment on proposed road names are limited by Deschutes County Code to those impacted property owners. No public comments have been received in response to either the notice of application or the staff decision approving the name change. If any comments are received prior to the July 14th signing of the board order, they will be relayed. Staff is now available for any questions.
Great, thank you. So one question, the 2 parcels, the Burkett and the Beach property, their addresses are going to be changed by this process?
Correct. So these 2 properties currently have driveways that take access from the subject road, and so they would have that.
So we did something like this a while ago, and one of the property owners just couldn't fathom the fact that their address was going to change and the front of their house wasn't, facing that little new court road. What is the opportunity to keep that Pioneer Loop address, I guess is what I'm getting to.
Mm-hmm. So these property owners were notified back in April. A sign has been posted also by the applicant on this road, letting them know of this proposed land use application. And the decision approving this was mailed out on June 30th, and that very clearly states that they will have their address changed, and no adverse comments have been received from those property owners.
Okay. Well, yeah, my experience is sometimes even after this process, the property owner will come in and say, "You're doing what? I didn't understand that was my property you were talking about." But we can deal with it if that happens.
But the cuteness factor for Hedgehog Court.
Oh, yeah.
Pretty high, so.
I like it. Yeah, that may be a badge of honor in a different address.
Cuteness factor, that sounds pretty important. No, I actually know exactly where Pioneer Loop is, so yes, been on that road, and to know it's only 1.6 miles.
So this is just an item for introduction. This will be on our future consent agenda, is that where it's going? Yeah, so we'll just see it come through on a consent agenda after this.
Great.
Thank you very much. Thanks for joining us, practicing in-person meetings, and nice to meet you.
Thank you.
Yeah.
Yes.
Thanks, Audrey.
So at this time, we will do our 10 o'clock COVID-19 update. A few moments early, but this is our bi-weekly COVID update. We have updated slides at this time, and yeah, following a holiday weekend without a lot of masks out there. Thank you for joining us.
Good news is there's a lot of vax out there.
Yeah. Well, and I would like to, we'll start off, as I say, the governor's orders were dropped on June 30th, and we'll get to some of this, but I think this last weekend it was a little news item that 70% of eligible people were vaccinated. So it was the big goal about 3 days earlier, and it was attained. I think it was Saturday. Yep. So we are ready for the COVID-19 to proceed. Yep. So there may be a set of slides that. Okay.
I've been doing or contributing to these presentations, I think, since last June, but this is the first time I'm actually in here.
I know this is another happy fiscal new year also, right? So this is a big day here.
Yeah, good. Have to admit it's a bit more nerve-wracking than doing it on Zoom.
Oh, no.
Oh, we've all been together in meetings before. But.
You should have brought some like Buckeye props or something.
Oh boy.
Some what?
Some Buckeye props or something to kind of.
Love it. You
If you bring your
know the way to my
Buckeyes.
heart, Commissioner.
Yeah, I'll bring my ducks.
To make you feel more at home.
I can't hear this.
Oh my goodness.
I am going to the game, though, in September, so
Oh. You're going to an Oregon Duck game? Is that
Yes.
what you said? Oh.
against the Buckeyes, against
Oh.
the professional football team.
Nahad. There's a couple ducks
Is it
coming
going to
through.
be here or is it going to be in
It's
Ohio?
in Ohio. Yeah. It's in Ohio, and no, I totally respect the Ducks and the Beavers. Except when they play the Buckeyes. So,
Now you say that. Okay.
so thank you so much. Do we have permission to start?
So this is our COVID-19 public health update. A couple weeks ago, we said we are going to do it every other week instead of weekly. As we were just talking as you were coming in, the governor's mask mandate and the emergency declaration have evolved since last Wednesday, the 30th. 70% of eligible Oregonians have received the vaccine. So the goal was achieved a few days after the governor had set that goal out there, or let the regulations go. So at this time, we'll go with COVID-19 update, and we'll have a good discussion through the slides.
Absolutely. Thank you so much. Thank you for inviting us. For the record, my name is Nahad Sadrazudi. I'm the Director of Public Health for Deschutes County Health Services. I'm joined by
Molly Wells Darling, Incident Commander for the COVID response.
Yeah. So many thanks to Jesse Terpstra and Morgan Emerson for their contributions to the slides. And let's get started with some positive news. And I think I can move it from here. It's not moving.
Maybe the
Click
keyboard.
try to click it.
Click it.
We'll find out.
All right.
On the keyboard,
Clicking everything.
not on the keyboard. Is there a page down?
There we go.
Awesome. Awesome. Wow, now I totally respect what you're looking at because it's very small.
Well, we have our own personal screen here.
You have your, of course you do, that's right. Well prepared. So, Commissioners, this slide shows our case count by week through the week ending on 7/3. So that's July 3rd. We had 55 cases reported, which is down from 67 cases the week before. So this is really, really a good trend that we're observing in our beautiful county. Now, there are multiple reasons that we think are contributing to the decrease in number of cases. Perhaps one theory is around school closures, and we're seeing less outbreaks in school settings, so that's contributing to less transmission. Of course, with the weather improving, even though we're in the middle of an excessive heat phase, but with weather improving, people are going to be outdoors more, so we know that being outdoors is better than being indoors in terms of transmission, so that's certainly contributing, and that was something we observed last year as well during this time. But probably the most important driver is, and one that we can safely say there's a cause and effect here, is the vaccination rollout in our county, in our beautiful state of Oregon. And it's, I have to just pause for a minute and reflect on how remarkable it's been that in March of last year, in fact, on March 11th when I landed, this pandemic was deemed or declared as a global pandemic, you may recall. And within a few months, by December, in a matter of 1 week in between each vaccine, we had 2 vaccines authorized as part of emergency use. That's unprecedented. Now, no corners were cut in this process. It's a reflection of base level research that was done for many decades on mRNA technology. And we were able to leverage that baseline survey or baseline research to get to a point where we could produce 2 very effective and safe vaccines. That's in December. Now, of course, in the US, we have 3 vaccines that have emergency use authorization. So we do have the vaccines, at least one of the vaccines is available for 12 years and older, and all 3 vaccines are available in our communities. So I do want to plead to our committee members, if you haven't had a chance to get vaccinated, please take 30 minutes out of your busy schedules and go online or through the help center and schedule your vaccination. As Commissioner DeBonne mentioned earlier, Oregon did reach 70%. I believe 16 years and older, is that right?
18 and older.
18 and older, so that's quite a feat. We are amongst the top states in the country for reaching this level, so we should be very proud of the decisions that we're making in this state. In terms of vaccination rate amongst age groups, for simplicity, I will maybe categorize the age groups into 3 parts. 60 and older, we are seeing really high levels of vaccination rate, above 80%, even higher in some of the other age categories older than 60. Between 30 and 60, we are seeing around 60% coverage, which is adequate, but of course we want that to increase. And then between 12 and 29, which is our adolescent and young adults, we have some catching up to do. I am impressed with the fact that we are almost at 40% between 12 and 15, and at 50% amongst 16 to 19. And I think with time, we will do better.
And 101% in one of those categories.
Which
100.1.
Which, Commissioner, speaks to quality of data that we have available, right? It's not always clear-cut in terms of our estimation because we don't always have the best data available. With people going in and out, these are just estimates. So that speaks to that point. Yeah. So thanks for raising that.
Nahad, and Molly, I'm wondering if you have a sense of what role schools are going to play in driving or increasing vaccination rates for 12 to 18-year-olds in the next few months. And one of the things I'm particularly wondering about is mask requirements in schools. My son is in 8th grader, and he'll still be in school with kids who don't even have access to the vaccine in the fall. And I assume that means that everyone is going to have to wear masks, but I'm not sure about that. But I also, I'm thinking about high school kids. I mean, they've had access to vaccine for a while now, but if our vaccination rates in the county are, 15% or less, or sorry, 50% or less for the high school age category, like are those kids going to be required to wear masks, and Will schools continue to offer vaccination events? And I just kind of, I'm curious, looking towards the fall, what drivers there are for kids under 18 to get vaccinated.
Did you want to?
Sure. So the schools, as you probably know, the schools have been very active in vaccinating up until the summer came in, a little bit into the summer too. So they have been collaborating with the county and with some of the local clinics in order to provide vaccination clinics at their schools. And then the other new change will be came from the state, is that the school-based healthcare clinics will also be providing vaccines. So at least that's the last I heard, is that the intention is they want those clinics to be able to provide those vaccines. So that will be something else that will be in place. We also, as a county, are looking at doing some dedicated clinics, more dedicated clinics for the youth in our area. So we'll be doing that. In relation to the masks, I haven't seen an update in a while. The last update I saw is that masking will continue in the schools. I know that the schools and the education, Oregon Department of Education have put out guidelines around what the future holds for that. But we can get more information on that and get back to you.
Molly, though, don't parents have to give permission up, is it under 14? Do they
Under
not?
14 and under, yes.
Yes, so, yes. And I think that is really important, that parents are involved in this process.
Yeah, on the mask usage for children 12 years and younger, and I have the OHA guidelines with me, OHA strongly recommends that those under the age of 2 do not wear masks, but those from 2 to 12, they're not vaccinated, that they do continue to wear masks, and that applies to many settings, including public transport, healthcare setting, as well as school systems. Those guidelines are being updated regularly, and I think we do have this time during summer where some further decision-making needs to be made in terms of cohorting and mask usage and what have you. I do want to pivot to the vaccination piece beyond the technicalities that Molly covered very well. Ultimately, what it comes down to, and even as a parent, I can attest to this, when vaccines do become available for under 12, probably the two institutions I will trust the most will be the providers, the pediatricians for my children, and the school settings, frankly, the school institutions. These are the ones where I have the closest relationship as a parent with the administrators, with the providers, and their words and opinions matter. So schools, to your point, have a very strong role to play in increasing vaccination rate because of the relationships that they have built over the years with parents when it comes to decision-making for their children.
Yeah.
So that's a big role, and we will be part of that as well to facilitate the rollout. Yeah. Right now, we don't have a vaccine available for under 12. I think our community knows that. We do expect, but there are trials, multiple trials underway. We do expect that by September, we should have some good data out, and it would suggest as to whether or not vaccines will become available for under 12.
Thank you. Yeah.
So Nahad, do you have any idea when it's going to go off emergency? Aren't there enough results out now to be studied in order to actually make them not considered an emergency vaccine, but as a standard one? When can we expect that to happen?
The exact timeline is unclear to me. What goes into that decision making is having enough time pass for us to know about short and medium term effect, adverse events, for example, associated with the vaccines. I know that a couple of the manufacturers have certainly, our pharmaceutical companies have certainly reached out to FDA for further discussion on this. So I think within the next 2 to 3 months, we should have some clarity on this.
Circling back on the pediatricians being a trusted source of information on this, I'm so glad that we were able to work with all of that handful of pediatricians and urologists to do that short, educational video about how getting vaccinated will not affect your fertility.
Right. Yeah. Exactly.
And I don't know whether that still has a role to play in encouraging, these younger people to get vaccinated, but I'm really glad we produced that and hope we're getting as much mileage out of it as is needed.
Absolutely. It's really important, all of us in the respective roles that we have, it's really important to respect the curiosity, the concerns and questions that parents and community members have around these vaccines, and accommodate their questions and curiosity by listening to them and frankly acknowledging their maybe fears and considerations that they take into place. Now that's different than deliberately disseminating misinformation or disinformation. That's different than deliberately being anti-vaccine. That I don't have much patience for, and I don't frankly engage in that. But vast majority of people are not in that camp. Vast majority of people just have some basic questions that they need answers for. So, Commissioner Chang, I think you asked before about what are we seeing in terms of our daily initiation for vaccines, especially first dose. I think last week or prior week, we were seeing over 100 first doses being administered. Maybe with the holidays, we saw a bit of a lowered rate. We're around 80 now per day. But we expect to see somewhere between 80 to above 100 per day. That's probably what a realistic expectation should be at this point. Okay.
Better than nothing.
Pardon me?
Definitely better than nothing.
Oh, absolutely. Absolutely. Yeah. Okay, this next slide is showing our testing volume in the community. It's really, at this point, at least for me, it's challenging to say what the threshold should be, right? We are seeing the cases go down. As a result of cases going down, the close contacts also go down. At the same time, people are, just rightfully so tired of this whole pandemic business. So the demand for testing is also impacted both by our perceptions and fatigue, as well as the case numbers going down. With vaccination rates going up, obviously that's going to, again, impact the sense of safety that we have or feel in or perceive in our community. Right now, what we're seeing is between 2,000 to 4,000 tests per week, depending on the week. It's hard to tell whether it's going down or up. I think that's pretty much the range that we are seeing right now. The positivity rate certainly is one important indicator for us to always consider, and that's roughly around 3% at this point.
It was 3% this last week?
Last week was around 2.5%.
2.5%, okay.
So we are seeing, again, we should look at it from a range of between 1 to 3-4%, and that's what we're seeing at this point. It is important, however, for our community members, for myself, for everyone to consider when it's really, really critical to get tested. Usually before and after travel is something to consider in terms of testing. Anyway, some of the airlines and some of the states require that regardless. So we don't have much of a choice in that. I believe Hawaii, for example, is one of the states that requires testing. So that's something we need to do. But even if a state doesn't require, or if the airline doesn't require, it makes sense to make that responsible decision or choice and get tested before and after.
Are you saying even if you've been vaccinated, you have to do it if it's not required?
This is primarily for unvaccinated. However, even as vaccinated, we're not 100% protected. However, I'm speaking mostly to community members who haven't been vaccinated yet. If we show symptoms, now this could be vaccinated or not, if we are showing symptoms, because there are breakthroughs, even though they're low numbers, like 1-2%, it does make sense to get tested at that time. And if we have been, if we know we've been exposed to a positive case, around a week after that exposure, it makes sense to get tested. Why we do that before even we show symptoms is because we know we can transmit this virus even without showing symptoms.
Naha, do we have so I know that we were working with OSU on kind of population level data collection through wastewater. Is that ongoing and like, you know, it is still occurring on a some weekly or monthly or some regular frequency basis? And do we have a sense from that data whether, you know, as we see cases go down, whether that's being, you know, that's actually matching what's happening in the wastewater samples?
Yeah, according to, so Dr. Conway is very involved in that process, and what he discussed with us is that certainly it's going on. There is some regularity to it, and it does correlate. The evidence that we generate from the surveillance, the wastewater surveillance, does correlate for the most part with what we're seeing in terms of clinical cases. More details, I think, can be provided. I think Dr. Conway was going to give more of a broader presentation on this topic. I'm not sure when that would be scheduled, but certainly it would be good to deep dive a bit into that.
Right. So if our individual testing levels are sort of tapering off, if we have that data on a regular basis, it's still that still kind of gives us some comfort that the prevalence of COVID in our community is really at a pretty low point right now.
To your point, like most diseases, triangulating data helps us have a more complete picture. So clinical cases, positivity rate, hospital admissions, wastewater surveillance, even antibody testing at some point, all of these help with giving us a more complete picture. At some point, allocating resources, scarce resources, whether it's in terms of funding or time or what have you, we have to make some choices and say, okay, what's the 20/80 rule that we can apply? Nevertheless, all of these are tools for us to have a better picture of what's going on in our communities.
Is the wastewater surveillance a relatively cheap way, you know, to get a set of data, or is it, you know, compared to individual testing, is it more expensive?
You know, my knowledge of wastewater testing mostly comes from polio. That's what I was involved with, and I know it's very resource intensive.
Okay.
I think what happened, I was initially involved in the wastewater sampling early on in the pandemic. Definitely early on, when it was still a novel idea for COVID, it seemed like it was more resource intensive. I think the technology has evolved somewhat for us to have gained some efficiencies around it. We should definitely have more conversation around it when next time we have this presentation.
Right, right. I can just picture, you know, as the, hopefully our cases have come down and they won't go back up again, but, you know, as COVID sort of tapers off, it'll be helpful for us to understand kind of what are the like simple, cheap, least invasive ways to track COVID in our community, and you know, I can imagine us getting to a point where we're only trying to do a few things, not everything, and you know, I'm just curious what those things are going to be.
Yeah, you're absolutely right. Those are good questions that we need to continue asking. One thing I do know is that Oregon Health Authority and in general the sentiments of the state and local authorities are to routinize COVID response into our existing programs, albeit with additional staffing and structures and what have you. So that it becomes yet another communicable disease that we are investigating and following up on and responding to.
Right.
Yeah. This next slide is showing our hospital admission counts. The good news is that we are seeing a drop in hospital admissions. Since the start of this pandemic, we are at 589. I know, Commissioner Adair, you're interested in this number, 589 ever hospitalized. The latest I saw this morning, I think, was around 8 admissions, less than 5 in the chute, and less than 5 ICU and vents. Mm-hmm. And Commissioner DeBonne, you raised, yes, during our prep for this meeting, some comparisons to the flu. And I think it's a good question because it's a reminder for us as to really what we're dealing with here. This is not, COVID is not another flu, it's not another cold, it's not another respiratory disease that we have experienced as global community or in Deschutes County. From some preliminary, research that I did yesterday, in the U.S., in the last decade or so, we have some estimates of flu hospitalization, and they range from around 300,000 in our good year to 800,000 in our worst year, again, in the last decade or so. What we're seeing with COVID nationally is over 2 million hospital admissions. So even if we compare it to the worst-case scenario that we had for flu estimates, COVID outranks it. In Oregon, we've had over 2,000 in I think 2018, 2019, or 2019, 2020, we had over 2,000 hospital admissions for flu-like illnesses, whereas with COVID, we've had over 11,000 hospital admissions in the state. So certainly it's a different order of magnitude.
Well, and that's exactly, thank you very much for looking into that, because previously it was just a reference point to 20 to 60,000 deaths annually from the flu, just a range of numbers in a 10-year period, and we could confirm 500,000 in a 12-month period for COVID. So, 20 to 60, if you go in the middle or high on that, if you said it was 50,000 generally, it's 10 times more. And it's just those points of reference. How do you put a scope and a scale to what we're dealing with here? So that's really good to understand. So I tried to take some of the notes here. I'm not going to try to repeat what you said, but you're saying, yeah, they're from a couple 100,000 to, 2 million or something you just mentioned, hospitalizations?
Yeah, and some studies came out. I think they were looking at CDC. It was MMWR, it was CDC, and I think they had looked at some veterans population, and it certainly showed that the severity of COVID was 5 times higher than the flu. I hope I'm not misquoting it.
Yeah, as I say, just the scope.
Absolutely.
You could really get more precise on those numbers, but at least it gives you a reference point.
Absolutely.
Thank you.
Which then takes us to the next slide. And this is something that Commissioner Chang, you have brought up a number of times. Where are we seeing the transmission? And frankly speaking, this is now a pandemic of the unvaccinated. That's exactly where we're seeing it. It's remarkable how safe and effective the current vaccines are. This is a human achievement that we should celebrate. And they're working. They're interrupting transmission for the most part. And where we are seeing transmission is amongst the unvaccinated, and where we're seeing the hospitalization is vast majority are amongst those who are not vaccinated. So the take-home message, frankly, is vaccinate and test. We have 2 great tools available. Vaccinate is even better than testing. You don't have to then test so much. So vaccinate if you can, if you're eligible, and then test.
Nad, so the other day I was finally able to make one of the public health advisory board meetings, because they happen on Wednesdays in the middle of our board meetings. But I was able.
Those hours, Commissioner.
Thanks. But I was able to catch one, and a number of the FAB members were asking. We've had these great partnerships with Crook County and Jefferson County, through the Mass Vax Clinic, which would have, essentially allowed us to support vaccination in our neighboring counties. And they were wondering if there was any work or efforts with Klamath County, because, our other 2 neighbors, that have lower vaccination rates, Klamath and Lake. Lake County doesn't have any population centers that are anywhere near Deschutes County, but when you think about northern Klamath County, I mean, there's so much interaction between people who live in South County and South Deschutes County and North Klamath County, and so I thought it was an interesting question about, are we doing anything to collaborate with Klamath County. And you know, North Klamath County is really far from K Falls. So, I mean, their access to the resources of the county are much, much thinner. So has there been any discussions or any collaboration along those lines?
Yes, yes, and go ahead, you start, and then I can add to it.
Okay. So when we started doing vaccines and throughout doing vaccines, we had clinics in Lapine, and so Klamath County was invited to many of those clinics, just like when they had clinics in North County, they also opened it up to Deschutes County residents. The other collaboration we had with Klamath was around our isolation motels and just helping them with their isolation motels. I think we actually have had a couple people come and stay in our motels, so we have been collaborating with them on that, yeah.
Absolutely. And this really speaks also to the fact that we're not living in a bubble. So we could have 70% rates here, but if our neighboring counties don't, and this virus is transmitting in those counties and continues to evolve and continues to become a different variant, which is redundant for me to say a different variant, but it evolves into becoming a variant, then we are also at risk. Right. So certainly we want to be helpful to our neighboring counties, both because it's the right thing to do and because it keeps us safe.
Right. And you just think about a major employment location like the Gilchrist Sawmill, and I mean there's people from northern Klamath County and southern Deschutes County mixing there on a regular basis, and so that definitely whatever we can do to support vaccination in North Klamath County, I think it benefits us.
Absolutely, and to our neighboring counties, we're open for business, so come and enjoy Deschutes County, right?
Yes, thanks.
All right, because a good economy is good for public health and vice versa. So some changes to mask guidelines. I think most everyone is aware that most of the mask requirements have been lifted, still, of course, encouraged if we are not vaccinated. So a lot of the requirements, just to summarize, a lot of the requirements that the state, the governor's office, OHA had are now becoming recommendations with a few caveats. And some of those caveats are that masks are still required at healthcare facilities. So Deschutes County Health Services, for the most part, is considered a healthcare facility. So if our community members visit our facility, they should understand that we are a healthcare facility and we have to abide by state rules and regulations around mask usage. That's really important for our community members to appreciate because it sometimes leads to very uncomfortable exchanges between our staff and community members, but we're following the rules.
So we'll get into the concept of so I'm not carrying a mask with me, but if I get, near a situation like this, I'll need somebody to offer me a mask at this time. So, the mask supply, the readiness of distribution or availability to grab it at the front door of a facility that's requiring it is going to be the next step we're taking. And then also, there may be medical conditions, and I really want to bring this point out, medical conditions or preferences or other high-risk individuals that you may be looking out for that provide, give you guidance to wear that mask, even in a public situation. Because we've already heard of situations where, why are you still wearing your mask? There may be a reason, so let's make sure we're acknowledging that and not judging.
Absolutely. Very good points. To your first point, as far as I don't know any healthcare facility, including ours, that does not provide masks at the entrance when people come in. We have made it as convenient as possible for all community members, and will continue to do so. And frankly, it might even become part of the way we're going to do business moving forward. Even if when COVID goes away and it's the flu season, having masks available so just people can put it on and come in is, I think, a good choice to be made. So that's to your first point for that. And to your second point, certainly reserving judgment is very important. It's actually very provocative, and it can be very shameful to the person experiencing it, and that's not the intention here. People wear masks for various reasons. My dad wears it sometimes just to keep his nose warm.
There were some cold winter days this winter. I'm like, man, this is kind of nice. Yeah.
For those of us who don't have beards,
Yeah. Just
Chance
the
to-
tip of your
to
nose
experience
definitely
that.
stays warm.
I shaved yesterday.
Yeah.
Okay, so with that, if you allow me, I'll pass to my colleague.
So as you pointed out earlier, the state of Oregon has met the 70% goal for 18 and above. Deschutes County, these particular stats are for 16 and above eligible individuals, and so we are at 69.4% vaccinated. The state of Oregon is actually at 66% vaccinated for this particular eligible population, so we're still ahead of the state and one of the lead counties in this area. Despite this number, which is a great number, we're very happy about that. We do still have work to do, so we just wanted to continue to encourage people to go out and get vaccines when they're ready to do that. You can go to the next slide. And there are several opportunities. So we have made vaccine as convenient as possible by having these through multiple clinics, primary care clinics throughout our community, pharmacies. We are doing clinics throughout Deschutes County that we'll talk about in a minute, as well as pop-up clinics. There are also opportunities for transportation, so CET bus system will give free rides to people who are going to get vaccinations for any age at this point in time. We're so thankful to them for that. We have other opportunities to assist people with rides for vaccination, so they can call our COVID hotline, which is at the end of this presentation, to talk with someone about help in arranging those rides if they need a ride. So we want to make vaccination as convenient as possible for people to get to.
Molly, those CET free rides, is that like the Dial-A-Ride service, door to door, or is that, you can get on the bus for free?
I believe it's getting on the bus for free, but if you do need a service door to door, you can call our hotline, and then they will work with you depending on insurance or no insurance, et cetera, on how to get that ride set up. So everyone should have access to a ride if they need it. So for Deschutes County, we continue to have our free vaccine clinics. You can walk in for your first dose or your second dose. If you got your first dose in another community for whatever reason, and you're back here, maybe you were on vacation or whatnot, you can walk in and get a vaccine for your second dose as well. These are for Pfizer and Moderna, and these are also for 12 and older. And we have standing clinics, so our community can know that every Monday they can go to Sisters Firehouse from 2 to 4 p.m., walk in and receive a vaccine. On Tuesdays, they can go to La Pine Chamber of Commerce from 11 to 1. Wednesdays, they can go to the Downtown Bend Library from 1 to 3. And then Thursdays, we are in Redmond from 9:30 to 11:30 a.m. at the library. And then we also have volunteer and medicine clinics, typically every week. This week, the volunteer and medicines is July 7th. Today. That is today, yes.
Going to be an effort for the rest of the year. I mean, basically for the next 6 months or so to get to the end of the year, and who knows after that. But yeah, this is a long-term effort to really make this easily accessible for the rest of this year, this calendar year.
Right. And in addition to these, we typically have at least one pop-up clinic. So pop-up clinics look like, we did one at a Mexican restaurant in Redmond. We've done a couple at the Catholic churches in both Redmond and Bend. We did a big event, which was super exciting in Bend at the Catholic church, where we had services there. Mosaic was there. Other service providers were there to help get people connected to services if they needed to do so. And we had some food and music. So some of the events are pretty fun, actually. So we look forward to seeing our community out there. We also can provide education at those clinics. So if you want to come in and just get education around the vaccine, if that's comfortable for you to do, please feel free to send people that way or come on in. And then we also,
Molly, where are the Johnson & Johnsons at? I know the Sisters Drug had a sign up that if you wanted a Johnson & Johnson, you could get it there. Where else can you get the J&J in?
Throughout the different pharmacies, and it really changes because most of those pharmacies are getting their allotments through the feds, and we don't have real-time we, as public health, do not get real-time information on that. But how the community can get that real-time information is to go to, I think it's vaccine.org. I'm going to have to double check that because I haven't gone there in a while. But that lists all the pharmacies, and you can actually look it up per vaccine. So if you have one particular vaccine that you'd like J&J, because it's the one dose, lots of people like that, you can look that up, and then it'll pull up all of the pharmacies in your area that has the vaccine. And there, I've gone on there for my my kids, and very easy to use. Okay, so at our clinics, we are also offering some fun. What's that? Vaccine what?
.gov.
Vaccine.gov. Thank you. Vaccine.gov for that. Thank you for checking that, Nahad. So we're offering some other fun things. We usually have a little bit of food, some beverages. We also are starting our $25 gift certificates right now. Right this week it's a grocery store, so that starts today. And then also people at each clinic are entered to win a $100 gift certificate. We've had some really cool stories of people who have come in and gotten their vaccine and won a gift certificate, and it was very meaningful to them. So that's been great. Again, these are open to anyone 12 and older, Pfizer and Moderna at these clinics, and no insurance, no ID is necessary. You can just come in and get your vaccine. And just as usual, if you have questions, you can go to our website, the Deschutes.org COVID-19 vaccine. We also have our email still up and running. People can email us at any time and typically get a response back that day. And then we also have our COVID vaccine. The COVID vaccine hotline is Monday through Friday now, 9 to 5. So people can call that hotline. They can call for any reason. I've mentioned transport before. If they have questions about vaccine, if they have questions about testing, we're here to help you through your questions.
Any reason related to COVID, right?
Anything related to COVID, yes. Yep.
Great, thank you so much for the update.
I do have a question. If someone does get COVID, because I'm always talking about therapeutics, that people actually, if they get COVID and they've got a few symptoms, what doctor do they call in order to find out what they should be doing for themselves, for their health?
When you say what doctor, you mean in terms of the specialty?
Right, I know. Do they just call their general
Yeah,
practitioner,
I
their
always start with
internist?
my primary provider.
Okay, so they need to have one then. Let's say they're 35 years old and they really don't see the doctor very often, then
They're also
they need to have a relationship with someone, right?
Well, there are also urgent care centers, yeah, where people can. I went to one actually a couple of weeks ago. I still don't know who my provider is. I shouldn't say that. Maybe.
Do not say that, Nahad.
But at least but here's the thing: is that we've really made it. We've made a conscious choice in Oregon, in Deschutes County, to make it as convenient as possible for people to access care. Of course, there are some caveats to what I'm saying. So if that's an issue, they have some questions, they can always show up at urgent care centers. Right on the spot, they can be seen for the most part.
Okay, so the good news is Deschutes County has only had 82 deaths. I realize that's a tragedy for those 82 families that lost a loved one, but when you look at the number of positive cases, I think we're over 10,000 now, that we've lost 82. I think our hospital has done an outstanding job.
Yeah.
So clearly an outstanding job, and I want to commend St. Charles for the doctors, for the nurses, for all those people that really have stepped up. And it's wonderful today to see that we're down to 8 people. One still in ICU and on a ventilator, but still, what an excellent effort they have done. Modern medicine at its finest.
Absolutely.
Thank
you. And I think, Commissioner, you're being humble in that from the early days of the pandemic, you and the other commissioners were role models in the way how this pandemic should be handled, and you were wearing masks even before it was even necessarily fashionable to do so. And wearing masks and taking those precautionary measures actually helped quite a bit in making sure that we were not exposed necessarily to high loads of this virus when we were exposed to them. And having lower exposure to this virus definitely helps with our recovery, more so than otherwise. So I think the role modeling that all of you did throughout this pandemic, and especially from the beginning, has also contributed to why we are not seeing more tragic news around it.
I think also just the relationships that you all create. You know, we are a very lucky community and blessed in the relationships that we have across all different healthcare providers, et cetera. And so, you know, just I think it's a reminder to our community too. We were able to do things very quickly because of all of our relationships and your relationships with other leaders and our ability to come together quickly. And, you know, in future crises, we want to continue to have these great relationships. So I'm so thankful for all the relationships that we have. It really has helped us to move quickly.
And speaking of future crises, actually, as you can imagine, commissioners, we, you know, we're like many entities, we're dealing with scarce resources, and that could be in terms of funding, but mostly right now it's in terms of staffing and quality of staffing. Most recently, we had our epidemiologist, Dr. Jenny Faith, leave the county for another very prominent position. So I'm very happy for her and really proud of you know, her accomplishments. At the same time, we are now without an epidemiologist. We have been without an emergency preparedness coordinator for a while. And we're dealing with excessive heat and soon fire and smoke, air quality, and all of that. So I think as we proceed with COVID and COVID response, we should also be mindful of how we're shifting our staff and resources to other crises that are imminent or are inevitable. For example, some of the deferred services during the pandemic that we will be dealing with. The syphilis cases are so high compared to what we've seen in the past. This is something we need to be dealing with right now. So I'm hoping, and I'm hoping you're hoping too, that we can start shifting our attention to other matters that are of importance.
So with that, do we want to do this every other week for a while, or does this feel like a point in time where there's, not as
Looking at
much
the
focus on
numbers
COVID specifically?
Today, you would think maybe we could do it in 3 weeks, you know?
We'll stretch it out a little bit.
We are
it's
trending
just-
down dramatically. If you take out that 164, because that had some prior numbers
Right.
bumped in it, our trend has been, 120. We've been going down.
So as I say, I've been offered to meet with the health leadership staff the day before, and just to look at the slides and kind of think about the big picture. So just provide a little bit of feedback, just readability or thoughts of what I think I'm seeing. So
I think
a
it's
little
great. I think it's great that our case numbers are low and hopefully will stay low in the next few weeks. I do feel like we still have a big job to do with pushing vaccinations out, getting vaccinations out to more people. So that to me would seem like a good reason to continue to have every other week.
When as I'm looking, 2 weeks from now is going to be kind of a week before the county fair, which will get a lot of. I support 2 weeks from now, just because of prepping for summertime events still. But let's talk about it each time and see where we go from there. You were asking about the sewage monitoring opportunities, and it'd be good to maybe get an update on that. If Dr. Conway's available or whoever can provide that. That's kind of mass surveillance.
They're actually testing in Redmond and Bend. I read a report on it the other day.
Yeah.
So,
Okay. Well, let's keep it to 2 weeks from now, but let's talk about it each time. And we'll go from there. Okay. Thank you so much. Great to see you in person.
Yes, who would have ever thought? 15 months later, Nahad, you're in person.
That's progress.
Yeah. So last item before, we don't have any executive sessions or anything else. So we think we're just going to be here for the morning session today. So item number 13 is campgrounds, recreational vehicle parks, manufactured home parks, and rural lands assessment. This is our community development has prepped us for this. I was notified of a request for an interview. We'll just 45 minutes or so. Just letting you know, it's kind of probably what we're looking at. but this is a great topic.
I'm really excited we're going to get to talk about this topic because it's important from a housing affordability perspective. It's potentially important from a homeless services perspective, and it's also important for us to start to understand how we can increase the number of campgrounds, because there's so many people in our so many people who visit our community who go and dispersed camp in the federal lands very, very close to town, and to me that just seems like a whole lot of impact and not a lot of economic benefit, and not a lot of capturing investment to put into sanitation and wastewater management and things like that from all those people who are camping in the woods right next to our communities.
Peter, thank you very much.
Thank you, Mr. Chairman, members of the County Commission. For the record, Peter Gutowski, Deschutes County Planning Manager, and joining me as technical questions come up about the zoning code behind me is Will Groves, Lead Senior Planner. I have a PowerPoint presentation that I want to share with the Board of County Commissioners. It's about 17 to 18 pages. It basically distills a memorandum that's somewhat detailed. The memorandum also includes a map that shows campgrounds, RV parks, and manufactured home parks for context. So I'll go ahead and engage the PowerPoint. And of course, as questions come up, please raise them and we can pause the PowerPoint. There are several items that we're going to discuss this morning to provide context on these types of land uses in rural Deschutes County.
Peter, if I could ask one context question before you even launch in. So a lot of the discussion of allowable uses surrounds zoning, MUA, rural residential, EFU, and I have to admit I still don't have a really good command of how much rural residential zoning and MUA zoning there is, and kind of where it is. So, I mean, if you could, provide me that little bit of context for starters. I have a decent sense of where all the EFU is and how much there is, but I don't have, when we were talking, when we first started discussing HB 2006, the emergency, the emergency, homeless shelter siting. Tom said, well, it's only allowed in rural residential zoning, and I mean, that sounded like it could be potentially useful, but then then later on it sounded like there's very little of that, and so it's not not necessarily useful for us outside of, HB 2006 may not be useful for us outside of urban growth boundaries, so.
We can. Will can walk up a zoning map. I was in the process of pulling up the rural housing needs assessment that Tanya Saltzman produced last fall. I don't have the acreages on the tip of my tongue, but I can tell you spatially, which Will could show in the laptop there. But when you think of rural residential 10 zoning, I think of lands south of Sun River. That's kind of our predominant holding. We have, thousands of rural residential lots that were platted prior to the state's land use system. And then as you work your way north from Sun River, there are multiple use agricultural 10 zone properties, rural residential 10 zone properties in and around Greater Bend. East of Bend, I think there's a scattering, what I would say is multiple use agricultural 10 zoning, some rural residential 10 zoning, and around in Sisters Country, as Commissioner Adair knows, as you work your way outside of Sisters urban growth boundary, there's some rural residential 10 zoning around Aspen Lakes. There's rural residential 10 zoning, but it's more of a checkerboard pattern as you work your way kind of in the center of our county and working your way north. We get into more of our agricultural lands that are irrigated from any number of our irrigation districts. But I can certainly provide those statistics, you know, at a follow-up meeting if the board is interested, or just in an email. I know that in the housing assessment that Tanya presented and produced a report, that those, I believe those numbers are listed there.
Well, the amazing thing, Peter, is that we can have 9,800 accessory dwelling units built in Deschutes County, and so that means those have to be at least 2-acre parcels. So that's incredibly significant for our housing shortage.
Yeah, I mean, and that's a great point, Commissioner Darren. It also reminded me, you know, just south of Bend is one of the largest rural subdivisions in Oregon. It's Deschutes River Woods, and that's zoned rural residential 10. So the rural residential 10 zoning really reflects those platted subdivisions that, and not just pre-platted, but those developments that we see around Gopher Gulch, in and around Bend, and then the multiple use agricultural 10 zoning are those lands that I think typically were platted, but were deemed back decades ago to have enough infrastructure or investment in place where the county could demonstrate that they were no longer viable or suitable as agricultural or forest lands.
Thank you.
Yeah, you're welcome. I'll make sure those statistics, I'm sure I have it right at my desk. Anyway, getting back to the PowerPoint. For context, the Board of County Commissioners last spring respectfully asked staff to return with some information as it pertains to the land use entitlement process for both campgrounds, RV parks, and mobile or manufactured home parks. This memorandum that's in your packet and this PowerPoint, which again distills that memorandum, talks about the land use requirements that are entailed in these types of land uses. Admittedly, some of the regulatory obstacles that I think deter these investments in these types of land uses. And the other thing that, sorry, I'm pushing the wrong mouse, is we also felt it was important as staff to talk about some other rural land use opportunities in Deschutes County as it pertains to LCDC's recent temporary rulemaking, which will become permanent as it pertains to the 2020 wildfires that occurred in several parts of our state last fall, as well as some recent legislation that was adopted by the Oregon legislature, House Bill 2006, that corresponds to emergency shelters. So we'll talk about that as well. So jumping right into it, this is the map. I don't know how well it's viewable on screen for those that are watching remotely, but this is a map that's in the board's packet. But just for context, you know, when you think about campgrounds and RV parks, those are typically, you know, structured for temporary recreational or seasonal uses, while we think of manufactured or mobile home parks really being more permanent, and they act as, honestly, as low-income housing for so many of our residents. Keep on going to the wrong computer. It's interesting, all of the uses related to campgrounds or RV parks or mobile home parks, they were established more than 40 years ago. The board recently approved a campground, somewhat contentious, just north of Bend. So they have an entitlement, but yet they have not, to my knowledge, started, you know, investing in the development of that campground. So the ones that we're talking about today or highlighting today are decades old, and admittedly, you know, some of our land use history is spotty. I mean, I did look at our land use archives through Dial to try to give the board the best information possible, but many of these uses were established in the late 60s or predominantly in the 70s here in rural Deschutes County. The memorandum, just for the board or for anybody who's listening at home or is going through the packet, the memorandum really uses three tables to provide more context on the 4 campgrounds that exist in rural Deschutes County on federal land. So that's a key distinction, that these are uses that are subject to Deschutes County zoning. I summarize also 7 RV parks and 16 mobile or manufactured home parks. So the regulations, which admittedly do require Deschutes County to follow state regulations or rules that have been established by the Department of Land Conservation and Development, and those are all codified in our zoning code. So campground regulations. Campgrounds are permitted conditionally in the multiple use agricultural zone and also in the exclusive farm use zone on non-high value farmland. There are specific standards that apply to campgrounds, and the board's well aware of these provisions, again, because they were involved in an application just a month or two ago. But there are specific standards that pertain to outdoor recreation, access, water supply, and sewage disposal. I wanted to call out some administrative rules that really bind what campgrounds have to meet. There's open space requirements for campgrounds. It does admittedly limit the density of overnight uses. There's camp space limitations, and I cite here that the spots can't be no less than 1,600 square feet. Each campsite has to have at least one parking space. There are yards and setbacks which dictate, how a property can be optimized. There are limitations to visitation, as noted there, no more than 30 days in any 60-day period. Again, underscoring that this is for visitation, not for permanent use. And then it's also worth calling out that campgrounds have to be licensed as a tourist facility.
Peter, are all of these requirements basically state statute, or have we, in some cases, has the state set an envelope and we've set a slightly narrower envelope than that?
I think, Commissioner, it's a combination. The rules that I just described are requirements from the state that are incorporated into our county code. Campgrounds have to have demonstrations of potable water. You have to have showers. You have to have other facilities. Will can correct me if I'm wrong. The state dictates those requirements, and then I think they largely leave it up to counties, in our case, to describe specifically what those requirements are. So we really take direction from the state, and we do have some, the fact that it's a conditional. And I'll get into later in this PowerPoint presentation to talk about some of the challenges or obstacles associated with regulating this type of use. These uses are conditional uses. The state doesn't tell us that they should be conditional uses, but in codifying these requirements in our zoning code, they are subject to not just general compatibility requirements, but specific compatibility requirements, as this board knows about, in terms of hours of operation, when quiet hours need to be imposed. And the reasons for that are these are very intense uses in the rural county that are in areas where there are rural residential or hobby farms that are proximate to it. And so the prior boards in the codifying of this requirement felt that this type of use, and really it pertains to all three, are of an intense nature that requires that compatibility obligation. So the state doesn't dictate that, the county does. So there's some discretion there in terms of how these types of uses are processed from a regulatory standpoint.
Yeah, the one in particular that I was wondering about, it was the 30-day limit.
That's coming straight out of state law. Okay, so I'm shifting now to RV park regulations. New recreational vehicle parks are permitted conditionally in the multiple use agricultural 10 zone. They're subject to some locational requirements. As noted in the memorandum, these locational requirements were added to our code in approximately 2014, 2015. an applicant wanted to add these to our codes. They apply to both RV parks and manufactured home parks as well, but there's some specific locational requirements which are noted on the PowerPoint. Being adjacent to an existing manufactured home or RV park, adjacent to the City of Bend's urban growth boundary, and having no more than 10 dwelling units on the site. So again, this was a provision that was added by an applicant in 2014. Interestingly, it was never acted upon. And so they were focusing, if you go just north of Bend on Highway 97, it's the Juniper and I want to say Hillside RV park there. I think at one point in time they were looking at expansion, and they wanted to broaden our regulations to allow to be more permissible for this specific location in our community.
So am I following this correctly? These three bulleted requirements are local additions?
Correct. They are local additions to provisions of our code that were added by an applicant, eventually adopted by the Board of County Commissioners, that said if you wanted to establish a new RV park in this particular zone, it had to have these locational requirements.
But I mean, these seem to be restricting the area where
the code was, I think prior to this, had even greater restrictions, and so this was opening it up. So, and when I talk about the manufactured home parks, in just a few slides, the 10 dwelling units, these are same standards that apply to RV parks or new manufactured home parks. The 10 dwelling units gets to the obligation of not exceeding the density requirements per state law. When you talk about manufactured home parks, I know I'm getting away from myself here. One can't exceed the density in the underlying zone for a dwelling. And so, again, I think these two parks have a combination of manufactured homes and RVs, so they were trying to find a way to broaden an opportunity in this location.
But looking at these three bullets right here, if these are local decisions, conceivably you could broaden availability or broaden opportunity even a little more.
Yes, you could.
If it seemed appropriate in balance with the other kinds of considerations.
And it's a great question. What we did in 2014, 2015, when this application was applied for, we notified all existing manufactured home or RV parks that were in the multiple use agricultural 10 zones to let them know of this text amendment, because it was had a geographic focus to Bend, and none of them responded to broaden it. And what I can't tell you right now is, how many MUA 10 zone properties are abutting existing urban growth boundaries. My educated guess is there's not. I think when you look around Redmond, there may be some around MUA 10 around Redmond. It has an urban reserve combining zone. So this was a customized amendment, and at the time, representatives of other existing manufactured home parks or RV parks did not testify to broaden it to meet their needs.
Another question, kind of differentiating between campgrounds and RV parks. RVs are allowed in campgrounds.
RVs are allowed in campgrounds. They are, depending on the applicant, depending on the application. So yeah, you can have an RV, you can park, so I think there's a subtle difference. RV parks, per county code, I think, you have to have different amenities, I'll call them, or services. But a campground, you could back up your recreational vehicle, stay there, and whether or not there are hookups to treat your wastewater or whatnot, I think those vary depending on the amenities that are being provided. RV parks have specific standards. I think there's a little more flexibility with campgrounds, because a campground, you could park your car and pitch a tent, or you could back up your camper van, or you could, if you're driving a recreational vehicle, there may be, depending on how the campsite's structured to accommodate, there's a possibility, or if you were towing a recreational vehicle. So it just really, I think campgrounds have a little bit more flexibility on what the type of client they're trying to meet. You'll notice in the memo, or I can remind you in the memo, some of the campgrounds do have one or two, they have a handful of RV park spaces. Some of that, for like the one that's the KOA, or the one that's near the Sisters Rodeo site,
Right next to it?
right next to it, they have an RV spot for a caretaker, so that they can manage the subject property.
And are structures like, like a yurt or a tent cabin or like even a little camping cabin, are those allowed in either or both of these?
I don't believe they're allowed in the RV park. In campgrounds, I mean, in the one that you just contemplated, there were a couple of yurts that were considered for that site. So it really depends on kind of what was originally approved. In this case, the ones that are existing, it just depends on what they proposed at the time. I off the top of my head, on the summation, I don't remember yurts being contemplated. I suspect because 40 years ago, the yurt concept was probably pretty new or novel.
But this is, one of the campgrounds I read about, it had little cabins in it.
Yeah.
So structures are maybe prohibited in the RV parks, but not in the campgrounds.
That's my understanding. I mean, Will could correct me if I'm wrong. The RV park has specific standards. There may be opportunities to, Will, do you want to clarify that? If there's the opportunity, if you wanted to propose a new RV park, to broaden it to take advantage of a cabin, for example.
Yeah, so, and Peter's on the right track here. So campgrounds are allowed to have up to 10 yurt units, or a third of their total units as yurts, whichever is smaller. So those are definitely allowed, and you could imagine that you could get, in some circumstances, a mixed approval for both an RV park and a campground that would provide both of those facilities. But the standalone RV park doesn't appear to have yurts contemplated as part of the mix in that specific development type.
Okay. And are there things besides yurts that would be permissible?
In the state parks, there's some allowance for cabins, but I haven't seen that otherwise for the private or county parks for something that was like a camping cabin. I've certainly stayed in them before, but I don't see them in the statute.
Okay, shall I continue with the RV park regulations? The code allows the expansion of an existing RV park on the same parcel to be permitted conditionally. There are specific standards that apply pertaining to, again, for RV parks, for potable water, sewage disposal, limitations on vehicle stays, these are the amenities, toilets, showers, and access, among others. And this is a requirement in the code, and I'll highlight it again under obstacles. But one of the requirements of our code for an expanding an RV park is they have to bring the entire area, the existing RV park, up to current code for fire and life safety reasons. And it's important to acknowledge this now, that these existing RV parks that were built decades ago, their access, in many cases isn't wide enough to accommodate the current emergency vehicle, or the fire truck, or the ambulance. Some of their water flows may not be up to current code, and if Todd Cleveland was here, he would also tell you that there are some challenges when expanding an RV park, because they don't have a lot of additional room for an updated septic system, or for an update, a secondary drain field. So there's real limitations on those expansions from a, like I summarized it here, from a fire life safety standpoint, but it's also due to public health. Okay, manufactured home park regulations, I mentioned this again, there are these specific locational factors that apply to new manufactured home parks that are centric to Bend's urban, being proximate to Bend's urban growth boundary. They are permitted conditionally in our zoning code. Again, you can expand an existing manufactured home park on the same parcel in both the MUA 10, and we also have existing manufactured home parks in our rural residential 10 zone. There are specific standards for manufactured home parks, similar to RV parks pertaining to potable water, sewage disposal, access, among others. And again, similar to RV parks, if you want to expand an existing manufactured home park, you have to bring the existing manufactured home park up to current code for fire and life safety and really public health reasons.
And so, sorry.
No, please.
Looking at that, if you can go back to that list, I mean, looking at that list, would you say the biggest bottlenecks on additional manufactured home units is those top 3 bullets, and then the requirement to bring the existing up to code before you can expand?
As I'll note, I have an obstacle, the regulatory obstacles in a few slides, but Commissioner, the biggest challenge for manufactured home parks, I think it's the first and foremost is you can't, if you expand a manufactured home park, you can't exceed the residential density of the underlying zone. And the board's aware of this, and I'm just conveying state law, is the density can't exceed more than 1 dwelling per 10 acres. So if you start expanding a manufactured home park, many of these were authorized really at the infancy of our land use program, you can't exceed that density. So there's, without taking an exception to Goal 14, which is a very difficult provision of state law to overcome. Then there's just, if Todd was here, I think you're going to find access, just bringing the whole manufactured home park up to code is daunting from an access standpoint, from a fire flow standpoint, and really from a wastewater treatment standpoint. You have to have a reserved, if you're going to be able to establish an expansion of a manufactured home park, having a drain field and a reserve drain field is critically important, and there's just not a lot of space in many of these cases to do that. So it becomes spatially challenging and cost prohibitive.
So Peter, looking back at the Sisters one, the fact that they have 1 mobile home there, but they are on 27 acres, does that mean they could add 1 more? Perhaps?
Potentially. I mean, you'd have to look at, you have to look at their approval, and I think their approval might have, I'm not sure if it was, I have to look at it.
It says 1974, or established.
And was that approved as a manufactured home park?
Well, it's on your list.
So the Bend Sisters, we're talking about the Bend Sisters Garden RV Park.
Right.
So the RV resorts are not subject to the density requirements that I just subject for. Remember, an RV park, those uses are temporary, whereas a manufactured home park, those uses are permanent, and that's where those density restrictions come into play. So presumably, any number of the RV parks, if they wanted to expand on if they had enough area to expand on their existing property, they could do so through a conditional use process. But at that point, it's, I think my projection is you really get into some challenges of bringing the whole RV park up to code for fire flow, wastewater treatment, and access.
Yeah, and if you're limited to 30-day stay, then what we're getting with the manufactured home parks, affordable housing, is not really.
Well, and I'll talk about it in the PowerPoint. It's also noted in the memo about some of the opportunities for discussion purposes of what the board could contemplate if they wanted to start thinking about how to engage the legislature about the importance of these types of uses in a county that's growing as rapidly as ours. I mean, Commissioner Adair knows that, I mean, she's forwarded communications from constituents who are very interested in expanding or establishing an RV park, and it's just really difficult to do so. So I think, I'm getting ahead of the PowerPoint, but it's germane now. You know, when you look at some of the emergency shelter provisions with House Bill 2006, or if you look at some of the provisions relating to displacement due to the wildfires, the land use system is stretching, recognizing these are critical needs for our community. And in our case, we're such a rapidly growing community that, you know, these types of conversations may be worth exploring as you set your sights on the, I know that's a short legislative session in 2022, or the full session, a regular session in 2023, how to begin elevating these issues to the legislature, because they do provide, the manufactured home parks do provide critical housing for a segment of our community that is in many respects low income.
Peter, if I might,
Please.
if I might jump in there real quickly. I think the reason why you see that this is difficult to do these in the rural communities is that the state intends, and the Oregon land use system intends, to put these in cities. But the economic, as I've talked to developers, the economic incentives aren't there. So, you know, if you wanted to have a high-density manufactured home park, you'd want to have it on sewer where the fire department was readily available, where people could get to the grocery store easily. And these are uses that Oregon has targeted for cities. But because of the economic incentives of selling off a single-family home site versus developing a manufactured home park and collecting rents over long periods of time, that it's not an economically preferred target. And so I think without some action at the legislature to force cities to take in, you know, as much as it's been difficult to get them to take in low-income housing, for example, without something that forces them to take these manufactured home parks, I think we'll continue to see them to be underprovided by our urban growth boundaries. But circling back around, that's why you don't see them, the reason why you see them largely precluded in rural areas is because they're a density of residential development that the state has looked to locate within cities.
So if we wanted to, if we wanted to encourage more manufactured home parks, you could encourage the things that will make it possible to do more of them in, the economic, address the economic drivers that would make it more feasible to do one within city limits, or, maybe it would make sense for us to push to have these, have a little bit more flexibility close in to cities, the way that, that requirement is starting to make more sense to me, although, if you're restricting this to, near the city of Bend, that's narrower than, you could see a place for these kinds of uses near unincorporated communities, near our smaller cities as well, so. Okay, thanks.
Yeah, and we'll touch on this in just a few minutes. I recognize this is a lot of information to distill and to underscore, because we're highlighting some very significant land uses. So I thought it was important to just highlight the recreational vehicle regulations that we have on our books, and this is consistent with what other counties do largely. Recreational vehicles are used as a temporary residence on individual lots that don't contain a dwelling in rural residential exception areas. So that's our rural residential 10, multiple use agricultural 10 zones. There are specific provisions that are highlighted that basically require that the recreational vehicle still be a vehicle. I won't, go through these four subset of bullets, but they basically are underscoring that the vehicle still has to be operational. A land use permit is not required if you want to use a recreational vehicle for a period of time totaling no more than 30 days in any consecutive 60-day period. If you want to use it for a longer period of time, not to exceed any, 6 months in a calendar year, then there's a temporary use permit for that. It's a few $100s. And I'll talk about the obligations of what that means momentarily. But there's the opportunity to do that. And we are seeing a number of these temporary uses on an annual basis, especially on those, as I look at Commissioner DeBone, who's familiar with southern Deschutes County, on those lots that just have high groundwater tables. This is an economic use that's afforded, and we want to make available, but there are specific obligations that have to be met to ensure that use is complying with really public health and public safety provisions.
And then, of course, there's the medical hardship permit?
There are medical hardships, absolutely, that are tied to an existing dwelling where a recreational vehicle can be used, and they often are where one can demonstrate that a family member requires a medical hardship dwelling. It could be a manufactured home. It could be a recreational vehicle. They have to tie into, demonstrate that there's adequate wastewater facilities. And basically, they provide, annually, they provide an update that they still need this facility with a doctor's note. It's a fairly straightforward provision of our code. We certainly understand the importance of accommodating these issues and do so on a regular basis. Oh, I went too quick. I thought it was important just to highlight the Land Conservation and Development Commission has temporary rules. Nick wanted me to let you know, it's noted in the memorandum, Nick Lelak, the Community Development Director, who's also a member of the Land Conservation and Development Commission, their next meeting, these rules are going to be permanent. And so these rules were established to assist those communities in the McKenzie River Canyon, in the Santiam River Canyon, in southern Oregon, to provide opportunities to accommodate those residents that have been displaced by wildfire, and provide interim housing needs that would otherwise not be made available. And it's just worth noting that it allows for temporary housing outside urban areas for a period of 36 months. There's opportunities for emergency campgrounds, temporary residential uses, and disaster-related sheltering. And there's a provision where an affected county can grant additional 12-month extensions upon the demonstration that the use remains necessary. So again, I highlight this. I think it may be worth just keeping this in the back of your mind as the Board of County Commissioners starts thinking about ways to engage our legislative delegation about these types of opportunities. While they're important for those that have been affected by natural hazards, we are also the fastest growing county in Oregon, if not in the country, that is seeing an affordable housing challenge. And it may be worthwhile to revisit these types of opportunities as well as a community, as a region, we collectively try to address housing opportunities for our community overall.
So Peter, do you think that LCDC, could you imagine LCDC considering a rule package like this for different kind of crises? Basically, one could argue that we are having an affordable housing and homelessness crisis in our region because of the fast growth and rapid development and displacement of many people. Could you imagine them kind of considering some?
It's a really good question, Commissioner. I would respond by saying the Department of Land Conservation and Development, which staffs the Land Conservation and Development Commission, receives direction from the Oregon legislature, and if the Oregon legislature provided rules or direction to undertake such an evaluation, I think they would do so. Left to their own, as Will noted, the program is really structured to take so many of these uses and apply them to urban settings. So without real impetus from our electeds at the state level, I think the Department of Land Conservation and Development is, their standard approach is going to be that so many of these uses are urban and warrant, you know, an analysis or an accommodation to try to make them possible in an urban environment. So I think it's going to take leadership at the state level. I think it's going to take leadership, you know, for local communities to speak with one voice, to engage the state, as this board has done on several occasions, to elevate this issue, to broaden the conversation. The other noteworthy legislation that was adopted just a couple of weeks ago was Housing Bill 2006, and it allows, as an outright exception, so it doesn't require land use review, emergency shelters outside an urban growth boundary in rural residential exception areas. So think of that as rural residential 10, multiple-use agricultural 10 predominantly. There's some provisions that have to be met in this bill that's now law. That it has to be, the shelter has to be operated by a local government or an organization that has the experience managing a shelter, like a housing authority or a religious organization. In this case, in their statute, it's under this new bill, they call them out as religious corporations, or a public benefit corporation, as well as a nonprofit corporation or organization. So if you have that kind of structural accountability, you can establish emergency shelters as an outright permitted use with no land use review. I also thought it was worth pointing out that the bill makes it easier for cities to approve parking lots where people can sleep in their cars as a form of transitional housing, and there's grant funding opportunities for organizations that want to create shelters. So anyway, it falls under this theme of, you know, as we know, we're in a housing crisis that just recently the Oregon legislature explicitly focused on emergency shelters to make that easier as it pertains to our municipalities.
Do you have a feel for what a definition of an emergency shelter is? So the words emergency shelter, because I'm envisioning there's a lot of people that would just like a geographic space, you know, 20 by 50, where they can set up a tent or roll in a car or put in a camp trailer. So yeah, what's an emergency shelter in this situation?
Give me a second. I'll pull up the bill.
And those aren't good long-term opportunities, but it's a start.
Right. Yeah, I mean, the one of the better managed camp concepts they've come up with in the city of Bend is it's basically a site where you could only use the site for 2 or 3 years. Anyway, I mean, so like none of this is, I don't think any of this is being envisioned as, we're gonna put this here for 50 years or anything. I mean, even the Veterans Village, they built those tiny houses in a way that you could, pick it up with a forklift and move it.
Well, that's actually transitional housing, and the fact that they're supposed to stay there for 2 years and then transition actually to more permanent housing. I think that's wonderful, because it gives people an opportunity to actually live in a tiny home, but then, have services so that they can get into,
right,
real houses. And I did notice the project south of Bend on the west side of 97 is really coming along. Remember, we approved that a couple years ago, and that's going to have affordable housing in it. So I thought I should make a call on that and see when their estimated day of completion is, at least for that first unit. It's a huge development.
Yeah. No, when I was talking about the portability of the tiny homes at the Veterans Village, I wasn't thinking about for specific residents, but we signed a 10-year agreement with COVA, and those conceivably, when 10 years is up, if that site's not needed anymore, you could pick those 10 or 15 tiny homes up and put them someplace else.
But outside of UGB in a rural residential exception area.
Yeah, and now I'm wishing I could look at the and you don't need to bring back, but can you remind me again where the rural residential is in the county?
Yeah,
Certainly. So it's, the RR10 areas in the county are located predominantly along the highway corridors. And what you see a lot of them south as you come into kind of between Sun River and Lapine, and also west of Lapine. Deschutes River Woods is a large area immediately south of Bend. There's also some areas in the southeast of Bend and out in the Alfalfa area. And then you see it along the highway corridor up towards Redmond and along the 97. A good chunk of it north and east of Highway 126 and Highway 20 out in Sisters Country as well. And then there's some patches in the Redmond area.
Yeah, there's there's also, rural residential exception areas, just to put it on the record, are also those urban area reserve 10 zones, which are very exclusive. Those are the lands west of Bend. Those are technically eligible. There's also a pocket, as you know, by Juniper Ridge, just near 18th Street. If you're heading towards Cooley Road, that's zoned suburban residential 2.5. It's a legacy zoning. We technically can't create zones now that are 2.5 acre properties without doing a goal exception, but those are also real residential exception areas that could potentially, accommodate a shelter. To the chair's question, Section 3 of the bill, House Bill 2006, says basically you can waive any kind of land use requirements if the emergency shelter, I'll just read a couple. Again, Section 3 includes sleeping and restroom facilities, complies with applicable building codes, will not, it's not sited in an area recognized for a natural hazard. It has to have adequate transportation access to commercial and medical services. And then
that already answered it. So
into the
sleeping and
operational.
restroom facilities built to building codes, that means it's a building, it's a structure. It's not just a,
Correct.
it's not just a chalked out rectangle on the ground where somebody points and says, okay, here you go.
Correct.
Referring to, the simplest version of somewhere to go.
I mean, maybe this is not a code thing, but I mean, like a tent pad, is built to certain specifications. I don't know, whether when we deal with campgrounds, whether there's code for, a campsite, like what.
Yeah,
So
that's what I was in.
Yeah. So
start
I mean,
with starting
Peter, does that sound right? That if we're talking about building codes, we are talking about buildings, or
I can't
Sleeping and
say- I
restroom
can't say
facility.
definitively, just looking at Section
Yeah.
3, it's saying will comply with applicable building codes.
Yeah.
He suggests it's got to be brick and mortar. There's also provisions that are optional that provide latitude that emergency shelter may provide on-site for its clients at no cost to the clients showering or bathing or storage and personal
Yeah,
property.
so it's
Laundry
it's a build.
facilities, but it's certainly the way it's structured. And Dave, I don't know if you're looking at House Bill 2006 right now, but with the fact that building codes are referenced and it's not explicitly calling out alternative forms of residential accommodations, to me says it's got to be in a structure.
And Peter, Section 2 says, as used in this section, emergency shelter means a building or cluster of buildings that provides shelter on a temporary
Yeah,
basis.
there you
There you
go.
go.
So it's which is Veterans Village, so we're already doing this.
Yeah.
But that's an example of emergency shelter, which is the built environment, which costs money to buy these supplies and the
right.
water utilities and sewer.
My impression is that there's, like nationally, we're not the only ones with these kinds of needs, and nationally there's models for more like, like not manufactured, but basically like a kit, that comes and you just you open it up basically and do a couple things to put it together and you can get.
Well,
I mean, where the tiny homes that are being built at the Veterans Village are really nice. Each one is individually built, but there's potentially some options for doing it more mass-produced and simpler.
But this is, could you go back, please, slide?
Oh, absolutely.
A shelter operated by government or nonprofit group.
Right.
This is, so that my thought process is, it's not a tiny home village with personal ownership either.
Oh, no, no. I mean, this would be, this would be in the continuum between the campground, shelter, transitional housing, kind of, these are not ownership opportunities.
And once you get, so my thought process was, once you get into a transitional village, you're in a tiny little, single occupancy structure of some sort. That may be a great option for you. So then a tiny home village could be the place.
Yeah.
So, I mean, just looking at options,
Well, I mean, then we're getting into, my impression is that, at least the city of Bend is working on special zoning to be able to do things like that. A tiny home, permanent community, as opposed to transitional housing.
So another question, when we use the words rural residential exception area, could you put that in context? What does it mean, an exception? An exception to what?
No, it's a great question, Mr. Chairman. Rural residential exception areas are areas acknowledged in our comprehensive plan to allow for rural residential uses as a use permitted outright. So those are the zones that Will and I have just highlighted. So that's the rural residential 10 zone, that's the multiple use agricultural 10 zone. Technically, it's the urban area reserve 10 zone and the suburban residential 2.5 acre zone. So there's 4 areas technically in rural Deschutes County that qualify to accommodate an emergency shelter under this new law.
What does the word exception mean?
You're taking an exception, the county took an exception to the statewide planning goals, which, as you know, are predicated on urban uses being in urban growth boundaries. These are areas that are recognized for rural residential zoning as those uses being permitted outright, and their accessory structures as uses being permitted outright.
Well, and so my point is, I mean, we need to remember that this is Senate Bill 100 from 1973, where you build houses in an urban area inside of a UGB, the terminology, and you only have you only have farming. So you put people in the cities and you leave the rural concept. And it kind of makes sense in the Willamette Valley, and it's never made as much sense in Deschutes County or some or most of eastern Oregon. So when we have these, and you started off pointing out the RV parks and the mobile home parks, they're all exceptions. They don't fit into the standard. And so if it's an interesting concept, if maybe it's time to have this discussion about it wasn't meant to be. According to Senate Bill 100, how do we have a non-conforming use for those existing parcels? Because we were only going to put people in these areas and not let people build in those areas. So I'm pointing out that it's just a terminology. It's inside and outside of UGB, and maybe the world is changing, and it never has made sense. I mean, let's acknowledge that. There's references in legislative history back into the 80s where the rules were being put in place in the valley for very valuable farmland, and some of them just never made sense here.
Well, I don't want to drag us into like a 90,000-foot
Well, we'll have to go to legislative
debate
though. If we want to change anything, we'll have to.
but I do want to say that we have thousands of residential properties in rural Deschutes County, many thousands, and we also don't have a solid string of houses between Bend and Sisters on Highway 20. So I would say that there may be some challenges with our state land use planning system, and some unique things about Deschutes County that are complicated to deal with. But I don't think you can say it doesn't work.
Well, yeah. So I'm referring to the fact that we've locked it down hard for the last 40 years, and it got us to where we're at.
But we have thousands and thousands of residential properties in Deschutes County. I mean, lockdown is a pretty relative term, and like I think we're getting into some useful analysis of what, whether these campground opportunities, RV parks, mobile home parks are viable in our community, and I kind of like us to stay at that level.
Well, yeah, I mean, that's fine. I'm putting out my comments and you're putting out yours. I'm just pointing out that this is in regulatory obstacles is next. This is a legislative discussion. This is the state legislature and the leadership at DLCD are the ones that have the authority over this, and I would refer to it as, lockdown, and lockdown pretty hard. So.
I've already written the word leadership down. We've gotten our Senate bill 391, which how long did we have to work on that? And I do believe that, when I know of people in our community that have 42 acres that have the possibility to do manufactured homes on that, but it doesn't fit all the zoning, right? Well, affordable housing, they could actually do those and charge a rent at $1,000 a month. They already costed that out. I think that's significant. In order to pay $1,000 a month, you need to make at least $50,000 a year, and that means $25 an hour when you back out your taxes and everything. And so, we have people in the community that actually see the need, and with the other 9,800 ADUs that hopefully are going to be built in the next couple of years, we can really get housing at a happier place in Deschutes County.
Well, and if you look at the dial on, I think I pulled up one of them, mobile home park, there's 15, 20 mobile homes on a smaller acreage. The annual tax dues for the land itself is like $6,000 or $8,000, and then each one of those houses is like $300. So, I mean, think about how cost-effective that is. And as I say, it's a shame that we don't have a path for, and they can't even manage them very well, because if they touch one thing, just like it was pointed out, you have to bring a whole bunch of stuff up to standard. So they're basically a fading entity, because if they want to improve it, they get stung by a huge overhead. So, and yeah, let's work through that.
And we have some opportunities to tinker with the restrictions that we've put on ourselves locally to broaden the area that's available for that
So,
land use.
a little bit of history, though. When we say we put those on ourselves locally, basically we have land use advocacy organizations coming in here saying, you won't do that. We'll bring it to the highest court in the land unless you negotiate with us. So that's when I say lockdown. The feedback loop for the land use advocacy is they've got a lot of leverage, and they tell us what to do and how to do it, or threaten with appeals to the end of time, which stops any of these investments. So I'm just saying that's what I've seen in a 10 years history as a commissioner. I'd love to be able to advocate for some of this. It's locked down from my point of view. So, but thank you very much. Now you can give us the bullet points on what's.
I see pathways forward, and maybe that's.
Well, and pathways forwards in the current system.
Within the current, there's some small pathways forward with the current system. There are definitely legislative opportunities, and if we approach them in a balanced way, we may not get the kind of resistance that you're assuming is going to be there.
Well, and I've seen it.
I know you've
It's
seen
been pretty
it.
consistent, the
Resistance?
opposition. Yes, the resistance, and yet, we hear affordable housing all the time. Workforce housing, our employers in Deschutes County are desperate for workforce housing. The hospital's desperate for workforce housing, having to put people up in hotels. Oh my gosh, so.
That's
yeah.
right, and just making thousands of acres available for building does not get you affordable housing. It's not just land supply. People actually have to have the right motivations and incentives to build something that is actually affordable. You could make hundreds of acres available and get a whole bunch of single-family homes that cost $750,000, and that is not affordable.
I was just talking about 42 acres that actually investigated, and our local long-term residents of our county, and they were really interested in making this with the manufacturing home project, which of course doesn't meet our regulations at this moment. So there are people that do want to do something that would really help the situation.
So let's focus on how to make some things that make sense, and that work with the vision of land use that the people of Oregon adopted. Move forward.
Thank you, Peter.
Next slide. Yeah.
Commissioners, as staff, we certainly recognize that the dynamic tension in this topic. I just have a handful of slides left. I appreciate your patience. I know that it's been you had a full morning, and we've touched on some of these regulatory obstacles because it just
Not even noon yet.
Okay, your stamina is strong. So we've touched on some of these regulatory obstacles because it just organically comes up. As the board explicitly experienced just a few months ago, campgrounds currently, and this is the county determination, are processed as conditional uses. And so there's general and specific compatibility criteria that must be met. And those are discretionary criteria. And what the board experienced is opponents can interpret those provisions differently than an applicant. And if they have strong objections, they can appeal decisions from staff, administrative decisions, to a hearings officer, or they can appeal a hearings officer decision to the Board of County Commissioners. So that's a factor that's involved when you have compatibility criteria that are subject to interpretation. I also acknowledged earlier that campgrounds require, under state law, provisions for potable water, toilet and shower facilities, wastewater treatment, lighting, picnic tables, garbage collection, for the, per state law, to cater to a temporary use. Those are expensive. And so, the summation is, to the best of our knowledge, as I look at Will, is like these factors likely, discourage property owners from really exploring a campground. It's expensive to provide these amenities, these services, ensure that the wastewater treatment has to be on site. You can't use a centralized wastewater treatment system. And, when you think about a water use, you're going to have to, it's not just relying on an exempt domestic well. You're going to have to rely on, probably a municipal water right, which is expensive because you have to, as this commission knows, the state Oregon Water Resources Department is no longer providing municipal water rights. You have to mitigate the need for a groundwater right. You have to mitigate that with a surface right. So it's very expensive to establish a campground because of these factors. And the other piece that maybe is worth highlighting is there needs to be, per state law, you have to be close to an outdoor amenity, which is with the most recent decision that the board approved, it was not appealed to. There was some lava outcroppings or features that could be, and there's a trail system, but staff, I think, always understood that having a recreational amenity was a campground's close to public land, or like Smith Rock State Park or Lapine State Park. There's amenities that compel people to visit a campground. So these are significant and likely, like I said, play a role in dissuading investors or property owners from establishing campgrounds in our community.
Peter, the campgrounds being a conditional use, that is the state's direction, or that is our choice?
It's the latter.
Okay. And so, I mean, with the particular example that we all just saw recently, I mean, there is a small location, lots of neighbors. I mean, there was important reasons to work through certain, considerations, definitely, and maybe that being a conditional use is appropriate, and maybe for a site that's a little less constrained, maybe it wouldn't be. I mean, would there be a way for us to, create like a two-tiered system where, if less constrained site, you meet these requirements, outright use, and then, more constrained site or more kind of potential, conflicts with neighbors, you still need to go through a conditional use process?
I think it's a very good question, Commissioner. I certainly welcome Will's thoughts on this as well. Of course, the board could set up a tiered system. It could be based on, acreage of a site, if you've got because you have to provide 65% open space, you could discuss, for the smaller acreages, you could make arguments that a conditional use criteria is necessary because of the intensity of the use in relationship to adjoining properties. So that's just one example. I think the reason why this was originally adopted into our code as a conditional use is because you are bringing in lots of users temporarily onto a property, and as the board experienced just recently, there's concerns about those impacts to adjoining property owners. But there is discretion there to allow it as a use outright, subject to site plan review, while ensuring that it's meeting the requisite amenities or services to ensure that the campground is functioning like one.
And to add in, if you think about the fundamental difference between conditional and outright uses, the conditional use criterion 18.128.015 gives the decision maker broad authority to think, is this a good place for this? Beyond specific rules, is there something special that, is there a reason why it shouldn't be here? Or are there special considerations that should be placed? Are we in a place where there's, noise is more of a concern, or odor, or something that you might not have thought about when you're setting the rules up? When you make something an outright use, you're setting it up like a lockbox, which is if you flip the switches, you get the use. For a developer, that can be very attractive because then you have certainty in your development process, or relative certainty. But for a neighbor, I imagine if you don't live on a rural property, imagine yourself on a 10-acre property where you built your dream retirement home, and suddenly you're finding that there's going to be 40 people on your neighboring property at night. Is that something the board wants to see a lot of everywhere without the ability to come in and make site-specific discretion if specific rules are met? Or do you not want to? Do you want to basically tie your hands and opponent's hands from preventing these types of things, or do you want to continue to allow the sort of discretion that you saw in this particular case? You've seen firsthand what the advantages and disadvantages of that more discretionary, the conditional review is, and the sort of mechanical lockbox of the outright use. If it's crafted very carefully, it can be effective, but then it requires a lot of foresight in terms of what you might see in the future to make the key fit the lock, as it were.
My first thought is if we were to open this up, probably still should be a conditional use, but we could sure look at the difference of the world that looks like today opposed to just 10, 15, 20 years ago. And I'm referring to the technology of the vehicles themselves that people can live in, the weather, the comfort level in all seasons, I guess, is where I was going with that. A little bit of water, power, and sewer, and people can be living pretty comfortably. So yeah, there's a discussion in there to back off possibly some of the conditional use requirements, and still, I'd still go down a conditional use path, I think.
And as long as these are only allowed, as long as people are only allowed to stay for 30 days, it's very, very temporary shelter.
Yeah.
So I don't know if of all the things that we could pick at with the legislature from a policy perspective, that actually would be one of the ones I'd be most interested in.
Well, and
discussing.
the boondocking people. I mean, you see them, the big, camper van conversions, and they're just coming in, they're rolling through from all around the country.
Right.
So they don't need a big fancy recreational amenity, river frontage, rock outcropping view. They're just looking for that place. If they had water, power, and sewer, they'd be very comfortable, even if it's a weekend kind of thing. So, yeah, a lot more, hopefully not as impactful and not high density, just the parcels, just like Commissioner Dare was talking about. Some people that have 30 and 40 acres, open space and a few spots, and it could be a great opportunity. So as I say, I don't know how much direction we're putting to this today. Thank you very much for the report, and now we're starting to dream about what's possible.
Yeah, and this was anticipated.
Yeah.
This is a lot to digest, and
Yep.
As we finish this PowerPoint, we can circle back in a couple of weeks if
Yeah,
the board is interested.
probably a good thing to do,
continue
yeah.
The conversation. This is really just to give you a baseline,
Yep.
Especially with the newer commissioner, to get you familiar with how our zoning codes are structured.
Right.
So obstacles for the RV parks, again, they're subject to conditional use criteria, the same circumstances that I described earlier for campgrounds apply to RV parks. They're obligated to provide, potable water and sewage disposal. There's service limitations on vehicle stays, toilets, lavatory, showers for each sex, access, among others. So there's an upfront investment for an RV park. And then, as I mentioned, the expansion of an RV park, to have to bring that existing area up to current code to ensure, adequate water pressure, wastewater treatment, internal access for emergency vehicles, it's a game changer. We've had those conversations in the past, and when they realize it, it's a hard stop. They just can't make it work. And so for manufactured home parks, we talked, Commissioner Chang asked the question, and it kind of jumped to this slide. Basically, new manufactured home parks are subject to density limitations based on the statewide land use system. And so you can't exceed more than one dwelling on a 10-acre parcel. If you want to exceed that density, you've got to get a Goal 14 exception. And even the best attorneys, would be hard-pressed to justify a Goal 14 exception, which basically requires you to demonstrate that this type of use can't occur in a municipality. It's really difficult to meet, and I think this is the primary factor for why we don't see manufactured home parks is this what I'll call this density cap. In addition, I talked about bringing up existing RV parks up to current code. The same applies to existing manufactured home parks. It's just too cost prohibitive for them to do that. Shifting to RVs, if you wanted to be, as I mentioned, RVs are required to be fully licensed and ready for highway use. There are those limitations in terms of how they can be serviced with utilities for water and sewer, and you can't obviously have any permanently attached additions to an RV. The moment that you want to convert an RV to a structure, the state's building code comes into play, and you basically have to have a foundation, you have to have structural integrity. I mean, if Randy Scheid was here as the building official, he would tell you the challenges that they experience as building officials statewide of having people live in RVs full-time. They're just not designed from a structural load. If you ever got a winter event, they can be very unsafe. But that commitment to have to invest in the RV from a structural standpoint, electrical code, et cetera, is why we don't see them permanently affixed.
This is the crossroads of that tiny home on a trailer frame too, where no, it's a tiny home, no, it's an RV, and it gets real interesting.
Yeah, so of course, temporary uses, we allow those. We also are dealing with more Americans with Disability Act circumstances for RVs. So I didn't highlight this in the presentation, but we've been working with Dave and his team. Those are case-by-case situations. The federal law requires reasonable accommodations. It flips the equation. It's how do you get to yes in many cases. That's where you lead So I want the board to know that you have a staff in the Community Development Department across the sections working with legal counsel to navigate those circumstances, which are becoming more and more prevalent. And we are doing everything we can to provide reasonable accommodations. So potential changes to state law, we also kind of hinted on this, but I thought it was worthwhile to have a slide that just acknowledges that there are these regulatory obstacles. There's an opportunity for the board to consider from a discussion standpoint, talking about potential changes. I'm certainly not asking you to do that now, although there's been some ideas or some concepts thrown away, but ones that I just listed, of course, they're not exclusive, but is it worth talking about how to, the importance of exploring siting manufactured home parks on rural lands? I mean, we talked about the LCDC's soon-to-be permanent rulemaking as it pertains to those that were affected by the 2020 wildfires. I think that could provide some context. And then, thinking about, temporary rules that deal with the housing crisis. Again, I think there's a lot to be learned. The state program did modify, did stretch significantly as a result of last year's wildfires, and you don't have to have a natural hazard to have a housing crisis. We all know we're experiencing one as a region, and I just introduced that second bullet there for the board's consideration. So thank you. I understand that we've been at this for well over an hour, and there's a lot of substance there. I do appreciate Will's participation as well, because he knows the code so well. But we look for any board direction going forward. But the obstacles are really, in my opinion, are centered on the state system that make it so difficult to establish these uses on rural lands that are of course subject to our jurisdiction. So those are non-federal lands.
As we were going through this, one of the things that came to mind that I would really like to see or understand is some market research. So we've heard about all sorts of land uses that could help us with, could help us with housing affordability, could help us with, potentially sheltering homeless people, at least a temporary basis. And I'm still interested in demand for recreational opportunities in the county as well, but I don't have a good sense of how. Thanks to you guys, I have a much better sense of what's allowed, where, when, how. But I don't have a good enough sense of how much demand there is for these different kinds of facilities or housing opportunities to have an idea of how hard to advocate for certain kinds of land use changes, or for how much. If we only need just a tiny little sliver of additional area would get us to, now we have enough potential manufactured home sites to really, meet some of the need or demand for this kind of affordable housing use. Then, we only have to advocate for, like a very narrow widening of the envelope. But if we have a sense that the demand is massive, then we would think about it differently, obviously, and then have to ask ourselves the question, how much of this should be going within urban areas, and what can be done to incentivize that, or kind of overcome the economic challenges to making that possible. So is there a way for us to do some market analysis, feasibility study, kind of work around this, either in partnership with existing manufactured home park owners or homeless advocates or public land agencies or park and rec around the campground end of things. I'm just curious whether or I mean even some more tourism promotion agencies on the campground RV park end of the spectrum.
I think it's a great question, and we can certainly reach out to what came to mind was Housing Works, and talking to our federal partners, the Bureau of Land Management, the U.S. Forest Service. I know that my initial reaction, and Will and I yesterday were chatting about campgrounds, and I think this is just an off-the-cuff observation, but we were just hypothesizing this is, that if you established if you could somehow double Chumalo State Park, I want to put on the record, that's not being proposed, that you would fill that immediately. And so, because of the demand here. And so, I don't know. I mean, I think it's a good question to ask in terms of how much demand, but we were chatting in the hallway, and it's just the moment you provide more opportunities, I think there is going to be that reaction. It'll get filled, and then there'll be another line waiting for additional opportunities. But in terms of, understanding, the demand, the circumstances, I think it's an excellent question. I think it would be beneficial for the board to, through staff or through an invitation, to hear from our existing manufactured home parks, our existing RV parks, to understand the challenges and opportunities. I know that the existing manufactured mobile home parks, that they provide critical housing for a segment of our community, and in many respects, these are properties that were built decades ago, and I think there are times where they struggle with utility services and whatnot. So to be able to have staff relay those challenges or opportunities may be beneficial for no other reason, just to understand how to ensure, if there's a commitment to ensure that housing remains in place, to understand their circumstances could offer another type of conversation about how to ensure that they remain intact now and for the foreseeable future.
But Peter, I was thinking of something along those lines where the building standards today, the lack of asbestos and things, and if we're talking about manufactured homes from that period in time, how much trouble do they have when they try and replace a manufactured home that someone feels the utmost necessity to update it to today's standards? And the fact that, okay, if we're having a really hot summer, are we going to have like that minus 29 degrees this winter? Are we going to have those major temperature changes? And are those they're like 50 years old. So what is the capacity? What's their life expectancy? And I think it would be great if we could bring some people in and just really see what we can do to help those people, because they are providing such a niche of housing in our county. And it's really, it's actually a little better than I imagined I love it that you have all the spaces available, but still, there's some of them I think, oh gosh, couldn't they have just a couple more?
Yeah, or could we have a couple more parks?
Right.
Great question.
So mobile home parks, manufactured home parks, that would be the opportunity or the play that I'd like to look into. What does that look like? Is there a possibility? Commissioner Dare, it sounds like you know somebody that's even looking at it. How many acres you said?
42, I believe.
So it's just interesting. What could happen there?
I'm good friends with someone that lives in the Four Seasons because of the fire issue, and I just spoke with her because I thought that was more than 12 acres, but apparently my memory was incorrect.
So, protecting groundwater, having water supply, energy efficiency for heating and cooling, all that, we know how to do that. It's important for all that. So, yeah, just picking off one, mobile home parks would be the interesting opportunity. I know there's a couple going in the city of Lapine right now, so there's a couple acres at a time being put in, half a dozen or 8 or 10 of them on acre or two. So the city of Lapine, that's happening right now. So, and those aren't for ownership; those are for rent. But we're seeing that. So it'd be interesting if there's an opportunity in the rural to do that with a full-on, new age septic system. I think there's technology out there that, can be, nitrogen reducing, next generation. And as I say, it's a shame that these existing ones have such a hard time getting up to speed, but a new one may be an interesting play. And if it's a legislative, we may need to have a legislative powwow about, what's a good ask from Deschutes County for the short session, just like you mentioned. And if not, if we come up with an idea and it doesn't get traction there, bring it forward, bring it to the next one.
Yeah.
Exactly.
There's also, I've heard about a couple of instances where, speaking of kind of like the ownership model and the ownership model, in terms of individual ownership, and the ownership model of who owns the mobile home park or the manufactured home park, that there are the USDA Cooperative Development Group. You think of them as like, helping wheat farmers, put together a wheat co-op or something like that. But in recent years, the USDA Cooperative Group has done a lot of work helping people who own mobile homes or manufactured homes in mobile home parks reorganize to buy out someone who's basically about to sell the property off, likely for a new land use, so that the people who are living in that mobile home park can continue to stay there and have sort of collective ownership over the land underneath their facilities. So I think there's some really interesting opportunities to explore not just the land use, but the kind of the financial and ownership structure around these type of housing opportunities as well.
Thank you very much. Let's bring it back in a couple of weeks and maybe one piece and go from there. We can have some discussions offline about what are the opportunities now that we've all learned about it as a group.
Yeah. One last thought on an angle for like a market analysis or a feasibility analysis for a campground. I really am, you mentioned Tumalo State Park, and I really am interested in exploring whether that large chunk of property that the county owns down by Lower Bridge might be a suitable place to put in another, essentially another park anchored to a campground. And because I think you're right. I mean, you talk to any state park employee who works at either Smith Rock or Tumalo State Park, and they'll tell you that the demand is out through the ceiling. So,
and we are blessed to have 3 state parks that are affordable for Oregonians and out-of-state visitors. And you're right that the beauty of Deschutes County creates significant demand. It's also not lost on me, just one of the chair's comments, that I 40 years ago, I don't know what kind of winter recreation we had. It was a different time, different set of material resources. But we're now, as the commission knows, we're a four season destination, and with the camper vans and others, investments, people are willing to visit and recreate in ways that they didn't decades ago. So it's a blessing and a challenge at the same time. So thank you so much for the opportunity, and we'll come back in a couple of weeks to continue the conversation.
Thank you.
All right.
Thank you immensely. I can tell it was a lot of history there.
Yep. A lot of preparation. So that's it for our agenda items. Is there any other items from board members, real quick?
I know I received emails regarding extending the ban to match Redmond,
What ban are you referring to?
the fireworks ban. Someone did say that on Facebook they were posting they couldn't wait till the July 9th was passed so that they could burn their fireworks. And I'm really hoping that people will wait till our fire danger is low, and perhaps maybe on New Year's Eve would be a safer time. But I do want to thank the entire county for following the ban. The reports were amazing that people were so respectful and trying to do the right thing for our community. So it was appreciated and it was noted.
Mm-hmm. I was at the Redmond Economic Development Board meeting this morning, so this was a transition from Janice DeBoe to Allison Hayek for the chair of the Ready Board right now, and Michelle O'Hara was selected to be from the Ready Board to the EDCO board itself. So just a little bit of business this morning. With that, anything else?
Nothing for me.
Seeing none, meeting adjourned.
I-
I'm sorry, Eric has something.
Yes.
Eric waited all morning for this. One more item.
The item is the NACO annual conference and the
yes.
election. The commissioners received an email from NACO talking about the upcoming election for NACO officers. The board either needs to designate one of the commissioners as the designee to vote on behalf of the county, or we could designate Katie Lighthall, who will be attending the conference. So there's some paperwork that needs to be done actually electronically. And then also who the board wants to vote for. I haven't seen the list of candidates or the slate yet. But we need to do something by this Friday in terms of designating the county designee or proxy voter.
I was the designee last time. I will, and I know we had a presentation from 3 people at the Sun River meeting, and I would love to review my notes on that. Is there any way we could, like, each one of us vote, give you the vote, and then you could figure out if somebody got 2 votes?
Yeah, and I could work with you, Commissioner Adair, on submitting once the board determines which candidate they support.
This is for the National Association of Counties, NACO, and I think it's just that second VP seat, isn't it?
Right, that's all I've
There's
seen.
no other votes.
That's the only
Yeah,
thing.
so that's it. And in the past, we've given a proxy opportunity to the AOC to vote in a block for the state of Oregon. So I think there's a way to do that. And then Katie Lighthall is associated with our Western Cohesive Strategy. So she has been Project Wildfire, and she's been around for a long time. Do you know Katie?
No.
So she just happens to be going from Deschutes County, but it's really not us proper. Yeah, exactly. So, but she helps qualify us because she's registered for the NACO conference, where she could vote for Deschutes County independently of AOC. So I guess that's our decision space, which was interesting.
Okay.
For me, part of your background question would be essentially how much historically have we tracked and engaged in NACO, both elections and just kind of their business matters. And
I went to Washington, D.C. for their meeting in September of 19, and I thought they were excellent. It was really a privilege to be able to go, and I learned a lot. And I just didn't think making the trip to, isn't it Maryland or something? Yeah, I just went like, oh
Yeah,
gosh.
no, I'm not going to Maryland.
Yeah,
So,
I don't think I want to go to Maryland.
Senator Hansel was a commissioner from Union County, I think it is, and he was the NACO
It's actually
president.
from Umatilla.
Umatilla, sorry. Yeah.
You knew it was a U.
I was close enough to like Ohio or Oklahoma. But he was the NACO president, probably 15, 20 years ago now. So, but he was Association of Oregon County, and then he got involved and put his name and became the second vice president. And so he was NACO president. And when you're a National Association of Counties, that's, you're in there with some, kind of the executive leadership of the country a little bit, not the, right. But, they're hanging out with the president at least once or twice or whatever, so it can get all the way up there. It's interesting.
I mean, they have multiple standing committees.
Yeah, a lot of committee
Historically,
work,
have
yeah.
any of you kind of tracked any of those, or?
I've been on the Technology and Communications Committee ever since I've been a commissioner, and I've been to meetings, on-site and remotely now. I've done that. And usually it's just the kind of the policy positions that bubble up maybe from a county somewhere. Does this make sense? Is this going to be in the kind of the positions of NACO? Because we do have lobbying efforts, we, NACO, across the country, have lobbying efforts for, position of counties that can get right into the congressional offices and stuff too, the different hearings NACO will be. And it doesn't happen too often, but once in a while, it can be front and center on a topic too. So we just got to be ready for that. There's nothing really hot in my world that I know of over there. I know that it could get really interesting.
Are any commissioners registered for the business meeting? It's the NACO annual business meeting on July 12th. It could be either in person or remotely.
I'm not.
So I'm not.
Okay.
And then during the legislative conference, which we missed last year and this year, or maybe it happened last year, and I don't know, I didn't go. But that can be committee
happen
meetings
last
also.
It did happen. I noticed it is on my schedule, but I have not registered, and that is Monday. Correct?
Yes, Monday, July 12th.
Yeah.
Oh, in fact, yeah, so.
So that would,
AOC not meeting?
right. It's, yes,
I
AOC
haven't
would
thought
not
that
be.
far ahead. That's
I know. I did
5
look at
days.
my calendar, and I did recognize that I needed to sign up for something,
Yeah,
so.
so I might, because, if that's the regular AOC day, then we'll be
Yeah, I would,
available anyway.
I would be planning on doing that. I'll have to let Sharon know to sign us up.
Yep.
I'll work with Commissioner Dare on getting a hold of kind of the slate of candidates and then talk to you each individually.
Yeah, so, are you comfortable with that?
Yeah, and I honestly, I listened to the pitches of those three candidates during the AOC meeting, and it feels very removed for me.
Yeah, it is right now.
It doesn't feel super important to me. So I'd be happy to either hand over our proxy to AOC, or I don't think I would have a real strong preference among those three candidates. So
then it almost becomes more urban density or rural. And of course, we're starting to be kind of a transition county. But, just like there's, 3, 5, or 7 counties in the state of Oregon that are in a little different world than the rest of the counties, it's the same way across the country. Either you're, LA, New York,
oh yeah,
Chicago,
and I picked
or
that
you're
up
the
from-
rest of the country.
I picked that up from those three candidates too.
Yeah.
They definitely represented that continuum, but
Yeah.
but for NACO, since we straddle that continuum, basically,
Yep.
there's a rural Deschutes County and there's an urban Deschutes County. Either way, we get something.
It's interesting when you put it in perspective. So there's 4.2 or 4.3 million people in the state of Oregon. In Los Angeles County, there's 12 million. That's 3 times the state of Oregon, basically, in one county. So when, there's 3 commissioners here, but I don't know if there's 3 or 5 or 7 or something, but there's a lot of people that are represented by one county. And there's a few of those counties across the country, obviously.
Yeah.
So.
And I did live in a manufactured home in LA County.
There you
So-
go.
Well, actually, yes. So, I know. Who would have thought, right?
Okay, well, yeah, so we'll follow up on that and get some direction
Very good.
as discussed. All right. Anything else? Meeting adjourned.
Thank you very much.